Okay, guys. So, yeah, so whatever questions you have, I repeat again regarding your certificate, if at all in the middle you have any question, note it down, keep it with you, right? The way I am carrying one notebook and, pen so that I note down the questions for you all. And we will be addressing it again. And we will be keeping these sort of webinars just for your awareness. It's free of cost, especially for the medical fraternity. Thank you, Dr. Sameer. And regarding the certificate, hi, Dr. Yogesh. Regarding the certificate, everybody, you all have to keep an eye on that. Once the presentation is over, on the chat box, you'll be getting the link. So, sir, we have touched more than 200.
Yes.
Yes. So, I think we can start. Should we start, sir?
2-3 minutes, just 2 more minutes, I guess.
Okay, sure.
Because we received 2000 plus, registration. So we are just waiting. Because medicals are very busy. Sometimes they are in the hospital here and there. So
सर हमें रिएक्शंस भी काफी मिक्स्ड मिल रहे हैं. कुछ लोग सोच रहे हैं क्या है ये, कुछ लोगों को पता है बट डिटेल में नहीं.
we are here for to raise the awareness basically. तो आपके मन में कोई भी क्वेश्चन से प्लीज डू आस्क. ठीक है.
Okay, guys, so let me just ask you one question. Are you all joining from India or is anybody there from abroad as well? Is anybody there? Okay, Wu Kaneki is there from abroad. Nitin. Okay, Nisha, Abdul. All right. Which country are you actually from? But yeah, the chat box is off. No worries. We will come to that. But okay, hi. Okay, Preeti is also there. Great. Gayas, Tanpreet, lots of people. And how many of you are just joining from Northern India, guys? How many of you are from Northern India? Sameer, Alok. From northern part of India, Northern India? Or probably East, West? Okay. Mayank, Mangal. We'll come to that also.
No, I think we can start. We can start. Sonal, you can start.
Okay, all right.
I think.
Okay, and from Southern India, how many of you have joined from South India? It's also streaming on YouTube, everybody. So if some of your colleagues or friends have not joined this particular webinar or have not got the Gmeet link, you can tell them to check their YouTube, like our YouTube channel, Academically's main channel. We are streaming there as well. All right, so let's get started. Thank you so much for the beautiful reaction. I will present my screen in front of you. And yeah, we'll get started with the presentation. Let's get started, everybody. So this life-changing webinar for you guys in spreading awareness regarding non-clinical jobs for MBBS, MD, doctors out here. Please listen to the presentation carefully. Please listen to the people who are going to talk about this carefully and note down your questions. We will be happy to answer them. Okay. Okay, so I hope my screen is visible. Can anybody confirm? Okay, yeah, it's visible. Great. Okay, so let's get started. Your eyes on the screen, your ears open. We are going to talk about high-paying non-clinical roles, doctors who educate doctors, an expert-led panel discussion. I, Dr. Sonal, very good evening to all of you. Wish a very good evening to all of you all. On behalf of Team Academically, this is a webinar wherein we'll be going to talk to doctors about doctors who educate doctors. Let's get started. So first of all, everybody, we as a team would like to introduce ourselves to you. As you all told me before the webinar, through the poll and reactions that you came to know about Academically through social media and various other channels, just a brief about our team. Academically is a world's first healthcare edtech created with a mission to help healthcare professionals build better, high-paying careers and access global opportunities. You have been hearing a lot about Academically, about the foreign licensure examinations, which we cater to not only to Australia but various other Gulf countries. This is a new field, a new spec where we're going to talk about the non-clinical high-paying jobs for doctors. So we bridge the gap between degrees and real-world success through industry-aligned upskilling and international licensing exam pathways. We, Team Academically, proudly support professionals in building sustainable, future-ready careers. And as you all can see on the stats, 1 million plus digital presence, 82 plus countries students are enrolled with us, 200 plus institutional partners, and 10,000 plus students around the globe with a great alumni network in the field of medical doctors, physiotherapists, nurses, pharmacists, and many more. Now, here comes the question. Why are we guys here? Right? All the doctors, you have been sitting with us since 15 to 20 minutes. You all have taken out your time just to make sure that why are we guys here? The reason is, see, from our doctors fraternity, there are 2 pointers, okay? For some people, becoming a doctor or choosing medical as a profession is a fantasy. Like if you talk about me, I was the one person who always wanted to become a doctor since probably second standard or third standard. And whatsoever it would have taken, I would have given my 100% to become a doctor, not knowing exactly what I have to do after I get that prefix in front of my name. For some people, it is because of family pressure, because from the third generation or the fourth generation of your family, you are a person who has to become doctor because your parents are. Nowadays, there are many people, there are many parents who do not want their children to become doctors because of the narrow opportunities, because of the less career opportunities we have, right? 10th standard में हमें ये पता लगता है कि नहीं, if you are doing your 10th standard nicely, if you get good percentage, your life will be good. Okay, we move to 11th, 12th अच्छा percentage लाओ, your life will be set. No, then you move on for your NEET PG. We give our 100%, our health deteriorates, our social life deteriorates. We are happy to give those sacrifices because we are going to become doctors. But what once you become a doctor? You have done your MBBS. The only path what we know is MD, right? And for that, you have to give NEET PG, which is again a very difficult exam. We are here to actually, take out the idea that is clinical practice the only path. You have invested years in medical education. And also, if you're practicing, the ones who have done MD or MS or DNB, you are having hard work, long hours, night shift, huge responsibilities. So because of this, many of us feel stuck in low paying, slow clinical growth, right? So the real question is, are there better or smarter alternatives? Yes, we are going to talk about all of this in today's webinar. Now, I'll just talk about our founder a bit. So, Dr. Akram, a PhD from the Faculty of Medicine and Health, the University of Sydney, Australia, Sir is a globally recognized academic healthcare leader, an international career mentor with over 14 years of experience across various countries like India, Malaysia, and Australia. Alongside, Dr. Akram helps our courses to develop in the developing of co-development and mentored by senior experts from leading pharma companies, global CROs, and top universities, ensuring every program is practical, industry-aligned, and designed to meet evolving global healthcare and pharma talent needs. Sir's work has already impacted over 1 lakh healthcare professionals across 82 plus countries, inspired to pursue international careers and redefine their professional journeys. Good evening, sir. Welcome to this webinar.
Good evening, Dr. Sonal. Thank you so much, everyone, joining for this webinar. Yes, so I remember when I started academically, I was the single guy and doing my all the webinars. So at the time, was started with pharmacy. Then secondly, we started for medical, and a lot of medicals, we have already, they are practicing in Australia as a medical doctor. But when I was doing my PhD was with the Faculty of Medicine and Health, means you are doing PhD in medicine, pharmacy, nursing, dentistry, all together. There will be one faculty है वहाँ पर सिडनी के अंदर, right? So when I was doing my PhD, so मुझे पता नहीं था, ये टाइप का जॉब भी होता है कि मेडिकल अफेयर क्या होता है या MSL क्या होता है. So one of my friend, basically the Dr. Sayan, he was MBBS FMGE graduate, and then वो सिडनी में आए थे MPH करने. एंड देन उसने फिर पीएचडी किया. पीएचडी के बाद में उसका जो जॉब लगा था वो था MSL का. एंड द जॉब वाज वेरी हाई सैलरी बिकॉज ही वाज गेटिंग अराउंड 150K. एंड आफ्टर पीएचडी इफ यू आर डूइंग इन एकेडमिक्स, इफ यू आर ए लेक्चरर सैलरी अराउंड 120K. बोले यार इतनी इसकी हाई सैलरी का ये कौन सा जॉब आ गया, राइट? There was another girl, she was a pharmacist and part-time doing PhD. And when she completed PhD, she also joined as a MSL in Sydney. उसका भी सैलरी रहा 140K के आसपास था. तो यार हम कह रहे ये कौन सा जॉब से So we was last 3 years we are helping doctors to practice in Australia, New Zealand, different countries. But I thought many of the doctors want to go into the non-clinical role basically. And recently I met one of my classmates. His name is Dr. Nitish Maheshwari. So he did 12th with me, 10th or 12th. And after 19 years, I met him recently. So he did an MBBS and MS. He is from GSM Medical College, Kanpur. He is one of the very famous doctor in our hometown in UP. But you are making a lot of money. You are must be happy, तो वो बोल रहा है यार आई एम नॉट हैप्पी. मैंने तो क्या हुआ? बोला यार मुझे टाइम ही नहीं मिलता है बिकॉज एवरी टाइम रात को 12 बजे 2 बजे कभी भी पेशेंट आ जा रहा है, उसका नर्सिंग होम है तो उसको देखना पड़ता है, राइट? हस्बैंड वाइफ दोनों डॉक्टर्स है. दे आर सेइंग वी हैव मनी बट देयर इज नो टाइम फॉर आवर सेल्फ. वो बोला यार ऑस्ट्रेलिया में तो डॉक्टर जो होता है जस्ट वर्क 40 आवर्स वीकली, राइट? एंड इंडिया में ऐसा कुछ क्या है, कुछ नॉन क्लिनिकल रोल है क्या जिसमें इन लोग को टाइम मिल पाए अपने लिए भी अपार्ट फ्रॉम सैलरी, राइट? तो क्लिनिकल पे क्या है इंडिया में, एक तो सेफ्टी इतने सारे इश्यूज हैं एंड सैलरी तो ठीक है, सैलरी तो डॉक्टर्स अर्न करती है, राइट? बट अपार्ट फ्रॉम दिस उनके अपने पास टाइम ही नहीं है यार. वो अपने उनका अपना कोई पैशन है, किसी को क्रिकेट खेलना है, किसी को टैलेंट, उनको टाइम ही नहीं है. Always they are in the OPD, sometimes they are in the OT, sometimes here and there, and no time for themselves. Then I remember my old time here, MSL, medical affairs, में executive physician, medical reviewer, and so many high paying jobs available है. डॉक्टर्स को पता ही नहीं है. डॉक्टर ओनली जस्ट भाग रहे हैं, वो जस्ट ओनली क्लिनिकल ब्रांच के पीछे भाग रहे हैं, राइट? बहुत अच्छा स्कोप है. तो आई थॉट we can start this so we can help them to build a career in non-clinical role.
Right, sir. And इस ये जो thought थी इसके वजह से we are all sitting over here. This was actually your plan, your awareness plan, and you have actually realized कि ये actual problem है कि लोगों को पता नहीं है इन सब चीजों के बारे में, और इसीलिए आज हम यहाँ पे बैठे हैं. सो थैंक यू सो मच सर फॉर द स्टोरी. वी विल कम बैक टू यू फॉर द Q&A सेशन. एंड गाइस, अक्रम सर इज राइट हियर इन फ्रंट ऑफ यू. आप अपने क्वेश्चंस पूछ सकते हो आफ्टर दिस प्रेजेंटेशन.
Guys, you can ask as many questions whatever you have about India or abroad. Last 15 years मैं तो यही कर रहा हूँ. I'm guiding the student, lot of medicals को. मैं तो अभी I was in Delhi basically last week. There are so many doctors came from MAMC or AIMS, Safdarjung. मुझे लगा यार ये तो मतलब इन लोगों को कुछ पता ही नहीं है. They are very one of the I can say very talented doctors. बट उनको पता नहीं है लाइफ में और भी कुछ है अपार्ट फ्रॉम दिस, तो दे केम टू फॉर माय गाइडेंस कि उनको कैसे लाइफ में जाके पढ़ना है. तो प्लीज फील फ्री टू आस्क योर क्वेश्चन. बस ये छोटा सा प्रेजेंटेशन है हम लोग का, एंड उसके बाद में इट इज लाइक 1-on-1 ओनली. Me and there are 2 more medicals with us. They are in the expert panel. Yes, Dr. Sanal, you can continue, please.
Okay, thank you so much, sir. And guys, so here was Dr. Akram with you all, and he'll be there to guide you, as sir ne bola, on one-on-one basis with the Q&A session. We'll be having an expert-led faculty, discussion regarding the various non-clinical jobs which you all can have. Coming down to the guest story, introducing first guest to our panel, Dr. Nishtha Khatri. She's an MBBS MD pharmacology. She is an MSL non-clinical expert as well, with 7+ years of industry experience. Hi, Dr. Nishtha. Very good evening to you.
Hello. Hi, Dr. Sunal. Hi, Dr. Akram.
Hi.
Hi. So, Dr. Nishtha, we have with you as our guest panel expert, faculty over here, and you have been a part of us in a lot of discussions and all that. The first question I would like to ask you before asking is, could you please give us a small introduction about yourself, and then let's move on to the next question.
Sure. So, as it's mentioned on the slide, I'm Dr. Nishtha Khatri. I'm an MBBS and MD in pharmacology. So I've chosen a different branch in the sense that pharmacology is a paraclinical branch. Looking at my journey, I've been working with Academically for almost about 1.5-2 years now. Thanks to Dr. Akram for introducing me to the academy and to help train other doctors and pharmacists, a great experience. Before that, in the year 2011, I joined my MBBS. I did my MBBS from the prestigious Grant Medical College in Mumbai. And after that, of course, it's a 5.5, 6-year course, including the internship. So by the time I finished my MBBS, it was 2017. 2016 itself, during internship, we started questioning me along with my batchmates. What do we do? Do we give NEET PG now? And how do we prepare? Some were giving USMLE, some were giving AMC, some were preparing for PLAB, some were preparing for NEET PG. The question that came to my mind was that, do I really want MD medicine or MS general surgery? Because everybody's taking it. Why is everybody just going for clinical branches? Because technically, as an MBBS, everybody is a clinician. So there's no question about being paraclinical and not clinical. It's a combination. And I was a top scorer, like I was a very good ranker. I took up MD pharmacology in my very first attempt without even thinking to drop. It was by choice. So my rank was decent enough. I won't say it was good for radio or dermat, uh, in the top 100, but it was decent enough for a surgery seat, for an anesthesia seat, or a decent clinical seat. But I chose MD pharmacology by choice. One important reason being I was interested in clinical research, which I figured out in my UG days, and I wanted a work-life balance. Like Dr. Akram mentioned, as doctors, we are subjected to long hours of work, 48-hour shifts at a stretch, 24 hours, sometimes even longer. That is something I witnessed during my internship and, of course, during our ward postings as well. So when I asked myself the question, do I want to get into clinical? The answer came, well, yes, I don't mind doing clinical, but if it was for few years, then yes, do I want to do this for life? Am I okay with doing 48-hour shifts for a lifetime? Picking up patient calls at 2 a.m., 4 a.m. in the night, midnight, doing emergencies. The simple answer that came to me was no. And that's how I decided MD pharmacology will be a very good branch, opening a lot of avenues for me. You know, as in somebody who is trained in pharmacology or even post MBBS, we have so many options. Like in the pharma industry itself, we have a very restricted knowledge that, oh, we'll join as a lecturer, we'll join academics. But there is a world much beyond academics. And academic environment is getting very competitive now, with the limited seats and the limited permanent seats, most importantly. So it's high time that we look at other avenues. Pharma companies have MSL roles, medical advisor roles, they have pharmacovigilance roles, HEOR, clinical research roles. In fact, you will be surprised that some of my clinical batchmates switched to pharma after a few years of clinical practice. One of my seniors, she's 4 5 years senior, MS Gynac, she switched to working in PV. Why? Because, okay, she thought 4 years I worked in emergencies, that's fine for me. She is helping people, no doubt. She's a doctor, she's helping patients. But does she want to take it up as a career? That came as a question. So, yeah, this has been my journey. And yeah, it's great to take this journey by, telling others. Awareness is very important, like Dr.
Yeah.
Akram mentioned.
True, Dr. Nishtha. And that's
Yeah.
the reason we are sitting over here, because if I would tell you about myself, before joining academically, before coming to know about academically, I had no clue except for NEET PG. NEET PG is the one thing which we are being told in our medical colleges or wherever we are, because people are also not aware. It's not their fault. There's no awareness created. So we actually do not know that, okay, there is an alternative to something. About Dr. Nishtha, very good story indeed, and we actually got inspired through that. One more question which I wanted to ask you is, as you told, as you mentioned about your friends, that a lot of your peer, a lot of your colleagues are already there in non-clinical jobs. So if you could just list down the perks, because you have been interacting with them, what are the perks which you have shifting to the non-clinical roles, or what are the experiences of your friends and colleagues, if you have any to share with us?
Yeah, certainly. So in terms of the benefits, the first benefit would be that the pay is good enough. Anywhere ranging from 20 lakhs, 30 lakhs, 40 lakhs per annum. So if somebody who's looking to start their own practice without a backup, having no clinic, nobody to guide in the family, without any hospital association or a
Yes,
contact, it gets very difficult to establish.
correct.
As entering into the pharma industry, It's, it's about experience, of course, but it's about performance. You enter the industry, irrespective of how many years you spent in the industry, you perform well, you get the perks of it.
Hmm.
That's the first benefit. The second benefit would be that the pharma industry is a very updated industry. So we have to keep reading for our knowledge growth. It's not just to treat patients or to do well in exams. So we get upgraded with new clinical trials, new clinical research studies that are being done, which even clinicians get to know a bit later. We get a first-hand experience of that. So these two advantages. The third advantage would be that there are too many options within pharma. Like I discussed with you, there is pharmacovigilance. So somebody who doesn't want to get into pharmacovigilance, tastes it, wants to switch, can go into medical advisor role. Somebody feels, yeah, I want to try something else. There's clinical research, there's drug development, there's health economics outcome research, there's international collaboration as well. There's more scope to collaborate internationally. I know that some of my friends, seniors, they always wanted to go international and they did it through the pharma route. They joined a company, worked a few years, and then they got an international transfer in different countries like Hong Kong, Europe, US, where the companies have their branch. Of course, not straight away, but after some experience in India. Yeah, so more or less this is what I can think of right now.
Great, great. And rest of the
And
things
what
we
about
will
Dr. Nishtha? Work from home, I mean, opportunity also is there,
Absolutely.
especially in PV, right?
Absolutely, sir. So I have two sets of seniors and friends. One who like to roam a lot. So medical advisor domain gives you to visit different cities, different countries. You stay in hotels, all the luxuries. So
Yes.
they roam for free. It's sponsored. And the second set of people, they love work from home. I mean, it's at leisure. There are some female doctors who have kids also. So they manage it, everything. They manage it very well in a
Yes.
work from home scenario.
Yes.
Yeah.
Yes, Dr. Nishtha. So indeed, a lot of perks and advantages. Many more would be left. We will discuss in the Q&A
Yes.
session. Thank you so much, Dr. Nishtha, for sharing. We'll come up to you for the questions which we'll be having in future. Next, the next guest of ours is Dr. Mrinalini Anand. She is an MBBS, EPH, MPH, having 6+ years of industry experience. Good evening, Dr. Mrinalini. How are you?
Dr. Milani, are you there? Arindam, can you please check?
She's there, she's joining.
Okay, 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 okay.
All right, no worries.
Wait, she's unable to turn on her mic.
Okay, okay, okay.
Not an issue. We'll wait for some time. It's okay.
Sir, can you have a look?
Mayur, unable to turn on her mic.
Yes, मैं वही बोला उसको admin access दे दो. Go
Okay,
admin.
guys. So before we come up to Dr. Mrinalini, so the perks what Dr. Nishtha was telling, let's just revise that. Number one is your work-life balance, right? A good salary, a good pay. And as she mentioned that one of her friends was an MBBS MS gynae, right? So she is doing this as well as the others. So, the main part or the conclusion what we get is that the domains, the different domains of being a medico is what you should know, because the condition or the situation for every person is different. For me, I may want, so I'm also doing a non-clinical role right in front of you, sitting with the team academically, not because I do not like clinical roles, but sometimes in life what happens, you need a work-life balance, especially for women out here, right? So there was one of the story which Dr. Mrinalini was telling me last evening, that the mothers, especially the working women, right, the mothers who are doctors, who have become mothers, they have small children and they have huge household responsibilities as well. Similarly goes the things for men as well, men out here who have to give a lot of time to your family, but because you're a clinical expert, you are most of the time busy with your patients, with your surgeries. So at some point of time in life, probably the passion takes a backseat, and the responsibilities and the need of being present everywhere is more important, right? Because you always have that feeling when you are there in your night shifts and all that, you see your friends, suppose you open up Instagram, you open up Facebook or any other social media, and you see your friends are partying, right? The IT people have got Saturday, Sunday off, right? So they have good weekend. For us, there is no weekend. On Sundays also we are working. We have morning OPDs. I'm sure how many of you are having Morning OPD is on Sundays. Could you please give me quick thumbs ups, everybody? Only one morning OPD? What about the others? And how many of you are very much, have done a lot of night shifts? I'm sure. Whether you are well, whether you are not well, you are expected to turn up, right? Yes. So these are the things which will not be, suffered from if you are there in the non-clinical role, because you have a stipulated time, you have a lot of growth as well. So you're actually going to explore your domains outrightly, which is very much important, right? So these were the things we were going to talk about. And if you talk about the main motivation to go into the clinical role is this: your work-life balance, your better career opportunities, and these are the perks. Get away with the clinical roles is not so much important, but it is the need of the hour, right? And that is why we're going to talk about now. Okay, so Dr. Mrinalini will be joining in 5 minutes, guys. In between, there are
Hi,
certain
Dr.
things.
Sonal, I'm here.
Oh, hi, Dr. Mrinalini. So
Evening.
we're waiting for you.
Thank you.
Good evening. How are you doing?
Thank you so much, Dr. Sonal. I'm very well. How are you?
I'm good. Dr. Mrinalini, can you switch on your camera if it's okay?
There's an issue with the camera, sorry.
No worries. No worries.
Okay.
You may continue. Yeah. So, Dr. Mrinalini, first of all, could you please introduce yourself to us?
All right, thanks for that. So I'm Dr. Mrinalini. Hi, everyone. I'm a medical doctor. I did my MBBS, my medical studies from abroad. My education was based between Bahrain and UK. As any medical student during their medical studies, might have gone through various phases of transition in their mind as far as their final career is concerned. Surgery was my final decision along with public health. So I ended up joining the first batch of the Global Surgery Task Force, and I was also involved with King's College London. And then, as it was destined to be, I was in the first cohort of the European Union's Europub Health Program amongst the top 25 medics to be selected for a dual master's, fully funded by them, for a dual master's in public health. So my first year of master's was in the University of Sheffield, UK, and the second was with EHESP, France. And after that, a couple of diplomas, a lot of summer schools happened between Greece, Denmark, Poland. And then ultimately in between, I was also doing my clinical training in Germany. And as it was destined to be, just literally a couple of months before COVID hit, I got a position with a very big MNC, and we started working on a project that had to do with AI, so with digital health. And my last project in the digital health sector had to do with GDPR and medical governance. And and currently I have transitioned to the edtech industry. Very happy to be part of the Academically family now as a consultant. And that's basically about me.
Great, Dr. Mrinalini. So as you told, a great story indeed, and you've got a lot of experience. So that would help us a lot as well in defining the course and defining the various domains of this particular non-clinical medical story jobs. Now, Dr. Mrinalini, my question to you is you told surgery was one thing in which you were very much inclined to, and you had got the role or the scholarship for MPH as well. I'm sure there would be a certain kind of motivation to go into the non-clinical part. So what was the need? Was it the need of the hour, or was it just your passion to transit in the non-clinical job role?
I think, thank you for that question, Dr. Sonal. Two parts to that, two sources of motivation. First was a private one, a personal one, and the second one was a professional one. So the personal one is, I lost my grandparents and my aunt in the 1935 Quetta earthquake. Quetta is right now in Balochistan in Pakistan. So this happened before the partition of India happened. So my father was orphaned at the age of 5. And as at that point, the British Medical Service or the Royal Medical Forces were not that well established, with very limited public health capacity. My main motivation to join public health was so that I can apply my medical skills and clinical knowledge at a broader level and help more people, be it in the form of governance, policy making, and that was always my forte. I had been also previously part of various Model United Nation conferences. I'd been part of a very special team that was sent to the United Nations headquarters as well in 2010. And that was one thing. And the second was a very professional one, that first of all, to have a good work-life balance. As medicos, it is not a hidden secret that we often struggle to give time to our parents, to our families, and with time, parents don't get any younger, and the number of missed birthdays, missed New Year's or celebrations can never come back. So that is one thing, and then obviously the monetary remuneration along with the appreciation that you get in the form of policy making or education, that is something that is not comparable to the medical field altogether.
That's true. That's actually true. So thank you, Dr. Mrinalini, for the great answer. The last question before we go for Q&A is, as Dr. Nishtha told us the various perks and advantages, do you want to add something more to that, or you could just list down, because you have been in connection with a lot of people, with a lot of students, with a lot of MBBS graduates who actually want to transit to this career. We were having a talk last afternoon, I'm sorry, regarding this particular thing, and you had certain pointers with you. Could you please share it with us as well over here?
Definitely. Thanks for that. So just adding on to what Dr. Nishtha had already mentioned, and what I had also mentioned earlier on, work-life balance is number one. A lot of people who would like to look into work from home opportunities, especially if they have embraced motherhood or they are supporting families, then a lot of people who want to try something new, as in they have worked in the clinical field for a while and they want to try something new, not hit the pause button, so to say, but hit the acceleration button as far as their own then I think it is no hidden secret that there is a point where you would also like to enjoy the bank account balance at some point, right? It's no hidden secret. So that is their 100%. And a lot of firms, especially pharma firms, have a lot of hidden perks as well involved, such as childcare, such as good PFs, good policy coverage, and these are something that might and most of the time are missing from government or private practices.
Right, Dr. Mrinalini. And medical marketing is the most used term which we've been listening to. And medical affairs is a big department, and there are lots of roles coming up there. We are going to talk about all of this. Thank you, Dr. Mrinalini. We'll come up to you in the Q&A session with a lot of questions of ours and this medical graduates out here.
Thank you so much.
Thank you. All right, guys. So here was Dr. Nishtha, Dr. Akram, and Dr. Mrinalini, your expert panel. Now let's talk about what we are having in your box today. A getaway to non-clinical roles, everybody, one by one. So the first one is Medical Affairs, Medical Science Liaison, the MSL role, which we have been talking about a lot. So you have spent years in mastering the clinical science. Now this MSL will multiply your clinical roles, right? Next is HEOR, which is Health Economics and Outcomes Research. This comes yet again as a non-clinical role. Next one is Patient Safety Physicians, especially for you guys. Medical Monitor, also called as Medical Reviewer. Things are same. We'll explain everything. Terminologies may be different at different places. Medical Writer or Medical Marketing. Next comes Clinical Drug Development, and then the healthcare data analytics. So we've been talking about healthcare data analytics right before our presentation, and not many people had shown a lot of good reaction for that because of the mathematics involved. So I'm sure we will dive deeper into all these in the getaway of non-clinical roles. Thanks for the thumbs up, and reactions should keep on coming, because as I told you, we are keeping an eye on your reactions and we will be taking up queries according to that as well. All right, so first we'll be talking about Medical Affairs or MSL, which is a job-assisted program to transform your clinical expertise into industry leadership. What actually is this? So basically, meet the Medical Affairs professional MSL. What is your job role? Scientific peer. You build trusted leadership with key opinion leaders. You become evidence communicator by turning complex clinical data into clear insights to improve patient care. Let's talk in simple words. Suppose, guys, suppose there's a standard drug, ciprofloxacin. Okay, ciprofloxacin is the standard drug for some particular disease or some particular condition. And after certain amount of research, or because lots of research and advancements are going on throughout the globe, you come to know that now ciprofloxacin is not used so much. Instead, we have an alternative. Now, suppose what happens if you, as a medical representative, will say this to anybody, no one will believe very efficiently, right? Am I right, everybody? Could you give me thumbs up? If a medical representative comes to you and says that doctor, that doctor, ciprofloxacin is not being used because of research, and so they'll say that, oh, no, this is something which you don't know. You are probably communicating, or you're probably promoting your brand, correct? But what if an MSL says this? So a medical affairs professional, they move on to various conferences, whatever research and whatever updates are coming up, they are the ones who will communicate them to you. So you turn complex clinical data into clear insights, right? All the MSLs make advanced drug research easy to understand for key opinion leaders in different conferences, in different meetups, and medical experts through scientific advices, right? And so if as an MSL, as a key opinion leader, you say this, it creates a different impact, right? And a lot of research papers and a lot of things keep on getting published, right? Do we have time to actually read this, guys? Give me a quick answer. How many of you actually go and read all the research papers in detail? Do you have the time to read that, okay, this stock was taken, this research was done? No, correct. Thank you so much for the reaction. So the doctors do not have time to read the articles. The job of MSL is to explain the entire thing in a very easy way. That is the simplest way to understand what MSL is, right? And strategic advisor, you shape the medical strategy and product development in a similar way. And salary matters, guys, based on the education. So if you're an MBBS and then doing MSL, your salary will definitely be more than any other allied sciences person, right? So this is a role in medical affairs if you talk about MSL. Reference case study, as I was mentioning earlier, ciprofloxacin was effective for typhoid, but new multi-center studies are showing rising resistance and higher failure rates. Recent evidence suggests that ceftriaxone IV or azithromycin oral leads to better cure rates and fewer complications. So this is the role of MSL. So based on this data, updated guidelines recommend shifting to these regimens, especially in high resisting areas. You are the ones who will communicate these to the top KORs. So why choose this career? Everybody, it's a booming industry growth. $6 billion by 2023 is the growth with 13% compound annual growth rate. A significant earning potential of 20 to 35 LPA, wherein you get average, yeah, this is true, everybody, listen to me carefully, average 12 to 18 LPA. Excellent work-life balance, as we've been talking about, luxurious lifestyle, and you have the opportunities to travel as well. So if you are from India, what job roles can you apply for in India? Medical monitor, clinical trial physician. Remember the terminologies. If you want to note it down, you can note it down. Medical Science Liaison, Pharmacovigilance Manager, Regulatory Affairs Specialist, Scientific Communications Specialist, Clinical Research Lead. These are some which we have been talking. What are these? Alternative to your clinical pathway. So these diverse opportunities demonstrate the high demand for clinicians with specialized knowledge in the industry. And your unique background makes you a valuable asset, guys. Ready to transition into a rewarding and impactful career? Yes, that is why we are all here. The next one is drug safety physician or medical reviewer. Thank you so much for the applause. First one was MSL, drug safety physician or medical reviewer. It's a job ready program. Drug safety for physicians, right? Let's come to this. So basically, what are the primary responsibilities? Adverse event assessment. Suppose ADRs, you all have heard about ADRs, everybody? Adverse drug reactions. So the reports of ADRs or adverse events from various clinical trials and all, right? That is your drug safety physician responsibility. You will be the one who will signal detection and risk management, right? You will prepare and review regulatory documents to ensure adherence to global standards, that this is the particular drug which is adhering to the standards from the different bodies like FDA, EMA, or ICH. Also, you will providing medical guidance to pharmacovigilance teams, the research and development team for fostering cross-functional collaboration between various domains. And next, medical writing, all of you have heard. Give me thumbs up. How many of you have heard about medical writing and documentation? Yes. So the format of clearly writing and concisely writing medical narratives for adverse events and contribute to the safety sections of essential regulatory and scientific documents. Simple words mein bole to risk management, compliance of reporting, medical guidance, medical writing and documentation for the various drugs. So guys, why physicians are a great fit? Why are you guys a great fit? There's a small example. So Dr. Arjun, an ICU doctor, he was exhausted from shift work. Okay. Now transitioning to patient safety, what does he do? He now reviews safety reports from clinical trials and post-marketing surveillance. Like you've marketed a medicine or a brand, what is the result of that? And still using his medical knowledge. You will not be feeling कि यार मैंने MBBS किया था अभी तो वो use ही नहीं आ रहा. No. You will be using your medical knowledge, but with a predictable schedule and the immense satisfaction of protecting patients worldwide, non-clinically. All right. So what will be your role? Clinical evaluation has to be there. Understanding the disease pathology, that what was the benefit or the risk of this decision. Medical writing, I already told you, and decision making under uncertainty. So, these are the roles which are being much more talked about in abroad as well. So this was drug safety physician, MSL. 2 done. Big thumbs up, everybody. Let's move on to the health economics and outcomes research, which we call HEOR in short. It's a postgraduate certification where clinical evidence meets real world impact. Very common in US, UK for checking drug economics because, their HER roles, it's always better for the outsider ones, right? Especially as Dr. Akram was telling me, he was actually mentioning me that why is it important? Because, you've come to know about US, right? That a lot of restrictions have been put up. Now here comes your role because they will come up to you to check for the drug safety and all that. So, HEOR is something which is going to be in high demand. What are the primary responsibilities? Data mining and dissemination. Data mining kya hota hai? Data mining is you have to check the market access and see the data assets of the various drugs or the various researches. Then you analyze and interpret it, ki whether it is cost effective, utility is there or not, budget friendly hai ki nahi, and cost minimization study, comparing it with different companies or domains. On the basis of that, you do data modeling. You build economic models if there is any change has to be made, and then designing the real world project on the basis of that. So that's a A to Z thing of HEOR. Did you understand, everyone? Extracting the data, analyzing it, creating a proper model for that, and then designing a product. I've got only one thumbs up. That is the role of HEOR, right? What is the full form of HEOR? Health Economics and Outcomes Research. Now coming down to team academically. Why our program is different, guys? Because we make you job ready. We will help you for CV, cover letter generation. We will guide you for and prepare you for the job interview, right? And guys, everybody, this is our first batch. So we will make sure that 100% placements are there so that you also advise us to your colleagues and others, right? So we encourage you. After this webinar, we will be telling you, there'll be a QR code I'll be sharing. Please go and attend our application test for the first super 30 people, right? Now, let's present a breakup for this particular thing. Our program stands out because it's an intensive, listen to me carefully, 4-month curriculum and hours of live interactive session. So you get therapeutic communication and evidence interpretation, KOL engagement, advisory boards, regulation compliance, everything. Industry expert-led faculty. You have 3 people out here. We'll be talking about that. So you'll be trained by ex-MSLs like Dr. Nishtha, Dr. Mrinalini and others, senior medical affairs professionals, and you will be getting Dr. Akram's global network. He has been in this industry for long, and we have got a great alumni network. So you're getting mentor support from industry professional, advisory board simulations, how you're going to go, medical strategy briefing, adverse event simulation. You're getting live opportunities as well. Placement support, yes, that is the most important thing. So you'll get mock interviews, interview preparation, LinkedIn optimization for your, especially your profile, and the CV overhaul, which we've already told you. So now comes the eligibility. Everybody listen to me carefully. I'm sure some would be MBBS, MD, MS. Which is the best role for you? On your screen. Medical Affairs or Medical Science Liaison, MSL, is for MBBS, MD, MS. PharmD, MPharm, BDS, MDS, PhDs in healthcare, because it requires strong communication skills.
I mean, here these roles they give first preference for medicals. Okay,
Hmm.
तो आपके मन में होता है कि यार ये फार्मडी या फार्मेसी वाला या बीडीएस वाला इज इक्वल टू तो सैलरीज में डिफरेंस और ये और डिफरेंट डिफरेंट रोल्स हैं मेडिकल अफेयर्स में, बट फ्रंट रोल जो है मेडिकल डॉक्टर को ही प्रेफरेंस है यहाँ पर, जिसने एमबीबीएस किया है फर्स्ट प्रेफरेंस उसी के लिए ही है. एंड कंपनी आल्सो वांट टू डू सम like kind of we can say some cost cutting, so they hire some other people for the back end roles. इसमें एम फॉर्म बंदा है या फार्म डी वाला है या बीडीएस है, बट दे गिव फर्स्ट प्रेफरेंस मेडिकोस के लिए फर्स्ट प्रेफरेंस है यहाँ पर.
Right. So if you are in BDS and then doing MSL, your salary will be lesser than an MBBS doing MSL.
Yes.
Sir is-
Yeah.
Right. Right, sir. Similarly, coming for drug safety physician or medical reviewer, MBBS, MD, MS are applicable because you require strong attention to detail, your experience. Next, health economics and outcomes research. Guys, your analytical skills should be very good. Similar goes for MSL, MBBS, MD, MSR. Again, there and salary breakup is again like MSL. If you're an MBBS, an MD or MS, your salary will be higher if you compare to the BDS.
In 1 minute, I just want to explain here.
Yes, sir.
अगर आपको इफ यू आर वेरी आउट गोइंग पर्सन, आपको बहुत ही मजा आता है ट्रैवल करना डिफरेंट डिफरेंट सिटीज में, डिफरेंट डिफरेंट कंट्रीज में, लग्जरी लाइफ जीना है, यू आर वेरी यंग पैशनेट है, कम्युनिकेशन वेरी स्ट्रांग है आपका, गो फॉर एमएसएल. ठीक है. अगर आपको वर्क फ्रॉम होम चाहिए, वर्क लाइफ बैलेंस वाला, तो फिर ड्रग सेफ्टी फिजिशियन वाला कैन बी, एंड HEOR में आपको एनालिटिकल वेरी स्ट्रांग है, मैथमेटिक्स में आपका इंटरेस्ट है, मॉडलिंग करना, एनालिसिस करना, देन यू कैन थिंक अबाउट द HEOR. तो ये तीनों में अलग अलग स्किल सेट चाहिए, हर एक के लिए तो नहीं है इसमें. यस
Yes, sir. Thank you, sir. Simple words में explain कर दिया sir ने. So overall required skill set, communication skill अच्छी होनी चाहिए, good scientific acumen should be there, data analysis for HEOR, strategic thinking, and a good leadership skill is again very, very important.
I will
Now
give you
here
one example here. Drug certification ka, I yesterday, one of my relatives, she is working as a drug certified physician, one of the top company in Bangalore. ठीक है. तो उनके तो बच्चे हैं, वो स्कूल को बच्चों को लेने जाती हैं, उसको छोड़ने जाती हैं, बच्चों को पिकअप करके लेके आती हैं, घर पे हस्बैंड को खाना देना है, मतलब ये बहुत सारा काम भी करती हैं एंड वर्क फ्रॉम होम भी कर रही है. तो ऐसा रोल इज वेरी वेरी गुड फॉर स्पेशली द वुमेन्स के लिए. ये वाला हाईली रिकमेंडेड रोल है. ये जो है डॉक्टर फिजिशियन वाला या मेडिकल रिव्यूअर या मेडिकल मॉनिटर, ये वाला जो रोल है. तो इसमें जनरली इवन माय वाइफ वर्क बेसिकली फ्रॉम होम करती है. तो इवन व्हेनेवर जब उनकी मीटिंग नहीं हो रही है, तो समझो कुछ भी अगर नीड है, खाना बनाना है, खाना गर्म करना है, मुझे खाना देना है, स्कूल से बच्चों को छोड़ के आना है, स्कूल से लेके आना है, सारा काम वो कर लेती है. तो इट्स नॉट लाइक कि चीज बट 100% वो वर्क भी करती है, जो टास्क मिलता है कंपनी खाते वो 100% भी करती है. तो ये रोल वन ऑफ द बेस्ट रोल है. अगर आपको वर्क लाइफ बैलेंस 5 दिन काम कर रहा है, वो भी वर्क फ्रॉम होम चाहिए, तो ड्रग सेफ्टी फिजिशियन, मेडिकल मॉनिटर, मेडिकल रिव्यूअर वाला रोल बहुत अच्छा हो सकता है आपके लिए.
Right, sir. So guys, that is the one of the perks जो sir ने भी explain किया. And coming down to top industry recruiters, you can see ये सारे recruiters हैं आपके, Lilly, Cognizant है, GSK है, and you have Pfizer.
क्या है ना, आपको पता ही है कि अर्लियर फ्रॉम द CDSCO एंड जितनी भी जो रेगुलेटरी एजेंसीज है, वहां पर मैंडेटरी नहीं था ADR रिपोर्टिंग, बट अभी मैंडेटरी कर दिया गया है. एंड एट द एंड जो फाइनल जो प्रोडक्ट है जो साइन होना है, वो मेडिकल डॉक्टर का ही होना है वहां पर. मेडिकोस का वेरी वेरी हाई डिमांड है यहाँ पर. In initial stage में they may hire for pharmacist or dentist or others, but at the end they need medical doctor to review the case. कि भाई यार उसकी वजह से हुआ है नहीं हुआ है, you need to basically do lot of things in that particular case. So this is also something आप still in touch रहोगे अपना medical science में, because all the मेडिकेशन हिस्ट्री रहेगा, उसका पेशेंट का हिस्ट्री रहेगा, एंड देन यू नीड टू थिंक अबाउट भाई इसमें कॉलेजिटी जो असेसमेंट करनी है कैसे रहेगा. तो वो इट्स ए वेरी गुड रोल. एंड देयर आर वेरी फ्यू कंपनीज यहाँ पर दिखाई गई हैं. इंडिया में अराउंड मोर देन 20,000 फार्मा कंपनी राइट नाउ, बट अगर हम देखें टॉप कंपनीज भी है, कम से कम 1,000 प्लस कंपनीज है. सारी कंपनीज को मेडिकल डॉक्टर्स का नीड है नॉन क्लिनिकल रोल्स में.
Right, right, sir. So guys, you will be in connection with top industry recruiters.
And,
If
and I
you,
must forgot one thing to mention here. You might be know earlier this is a H1B वीजा का बहुत इश्यू चल रहा था अभी इंडियन को, राइट? तो इसमें क्या हो गया है, इसमें बेनिफिट फॉर इंडियंस. Now the company is paying in US 150 to 100 Australian dollar. Same they can hire in India maybe 30-40 lakh Indian rupees में easily for medicals here. You know? So HEOR में भी बहुत सारी जो है वैकेंसीज बढ़ रही है इंडिया के अंदर. जितने भी CROs हैं, they are taking the job from US and Europe, and जो इंडिया में अभी सारे MNCs वही करते हैं, CROs हैं वही जॉब कर रहे हैं यहाँ पर.
राइट सर, उनको कम पैसे में वो लोग मिल जाते हैं जो वहां पे उनको बहुत
बेस्ट लोग मिल रहे हैं बेसिकली, कम पैसे में बेस्ट बंदा मिल रहा है. MBBS मेडिकल जो है काम करने को उनको मिल जा रहा है.
So can I just add to one point over here?
Yes, Dr. Nishtha.
Yeah. As rightly Dr. Akram Ahmed said, pharma is expanding in India and it's going to expand even further. Recently, we had the India-Russia agreement, and as per that too, Russia is going to invest to have more pharma companies in India. US was already doing that, and a lot more countries are going to do that. So this is a branch which will never be saturated.
अभी जो आपने देखा होगा हैदराबाद में नंबर 1 कंपनी लाइक एमजेन तक वहां पे आ गई है. जितनी भी टॉप कंपनीज हैं राइट नाउ दे आर चूजिंग इंडिया. बैंगलोर, मुंबई, हैदराबाद, चेन्नई, ये सारी टॉप फार्मा कंपनीज यहाँ पे आ रही है.
Right. So that is one of the motivation. जो you are actually getting to know the facts, right? जो भी industry experts हैं, they're telling you the facts कि ये अभी चल रहा है, which probably you will not get to know through any other field. So that is the only way of, that is the only reason for this particular webinar. So coming down, everybody, please attend the scholarship test, the test on our portal. We'll be sharing the details with you with the QR code. So 30 limited seats are available. Enroll in our Super 30 batch. We offer you admission, interview, counseling session, admission test, application screening, and application submission. So from treating one by one to patients to impacting medicines used by millions, your clinical expertise deserves this platform. Also, we'll be sharing our community channel link with you all. If you get the community channel link, you will be one of the free, you'll be getting free membership of this. So you find us on Google. These are our Google reviews. You can go and visit our page, Academically Global Dehradun, Academically Global Australia. You can visit our page for Delhi and Hyderabad also. Everybody can scan the QR code for our social media handles. You can follow us on Instagram. You can follow us on YouTube. All the important recent updates, FAQs are all pushed up over here, and you can be well informed about the industry, whatever is happening. So guys, please scan to join our WhatsApp community, everybody. Every big achievement will start with one. And if you join our WhatsApp community, guys, you all get a free access to Jobsly. What is Jobsly? Jobsly is a job promoting platform. So you get, whenever you sign into Jobsly, it's a platform of Academically, you get to see jobs of various kinds, of various roles. So please scan to join our WhatsApp community because you get a free membership or free access for Jobsly, which is our job portal. All right. You can contact us on this particular number. Our email ID is upskill@academically.com and our domain is academically.com, as you all know. So I'll freeze my screen over here, and then you all can join our WhatsApp community and get a free access to Jobsly as well, right? And we will start not by wasting a single minute. We will start with the Q&A session quickly, everybody. Okay. Right. So lots of hearts we are getting. Okay. I will just rejoin. Okay. It's all good. Okay. Fine. So I'll just freeze my screen on WhatsApp community and we can move on to the one-on-one Q&A. I'll call out your names, guys. Please mention your question is for which expert. And after that, we'll be taking up your questions.
Hi, my name is Dr. Ammu.
Hi, Dr. Ammu. 1 second. I will just present my screen. I'll come back to you, Dr. Ammu. Okay.
Hello.
Yes, ask your question. Okay, I'll call out all the doctors out here. Just a small request. I'll call out your names one by one. please, only then unmute yourself and ask your question. Okay. So first I'll start with Dr. Ammu. Dr. Ammu, your question, please.
Yeah, I'm a 42-year-old doctor having 10 plus years of clinical practice. I'm now done my PG. I'm struggling with my family and having struggled with work-life balance. So I want to know, with my 10 plus years of clinical practice and with the UG degree, what can I do further? So if I have asked many of the agencies and all that, so they are telling me that for your age, these countries are closed for you. So only some countries are opening up for my age. So what should I do again with my profession?
Okay. This question is for whom? Dr. Ammu, could you mention?
Yeah, this question can be Dr. Akram.
Okay. Akram sir, you can answer, please.
So 42 is the age and want to go abroad, right?
Yes, sir.
Yes, yes.
Yes. So the best thing is for you, you can write this AMC exam, part 1, N plus English, and there's a very good chance for you to land a job in Australia.
Okay.
You can become a GP in Australia very easily.
Okay.
Yeah. So we can help you. We provide AMC preparation, all those things, documentation, all those things will help you.
Okay.
Arindam, can you please arrange someone for the AMC counseling one-on-one?
Yeah, sure. I'll do that. I'll do that.
Yeah.
Okay.
Okay.
Thank you,
Hello.
Dr. Ammu, for the question. I'll come up to you.
Hello, hello.
Yes,
Yes,
Hello,
yes.
my question is, what is the age criteria for
No.
going this?
So
Any
for
age criteria?
there is no such age criteria for these kind of job, non-clinical job. But if you have, under 40 is good to try, in this non-clinical role. And if you want to go abroad, for example, then your age must below 45 years of age.
Below 45?
Yes.
So if I am 60, if I am 60 plus, what is the choice for me?
Nothing. I mean, 60 के बाद तो कोई country visa नहीं देती है because they required, the young people, young doctors in need. So I can say you can be, India में ही आपका नहीं है अभी तो you cannot move abroad.
Okay. Initially you told there is no age criteria, but now you're
I
saying
mean,
is 60.
non-clinical role in India there is no age criteria. But आपको foreign जाना है, I'm telling foreign के लिए age criteria है.
For doing this qualification, this addition qualification, MSL, for doing for studying this MSL.
The role is very, very, they need someone very young guy can travel to, today might be in Bangalore, next day might be in Mumbai, next week might be he's in Dubai. Sometimes there's a lot of travel in this role.
Right, but if you can't go to abroad, but at least we can serve in India itself.
जो MSL का role भी है, so there is sometime conference in US, sometimes conference maybe in UK.
Okay.
So you need to go and attend that, and need to talk about the, maybe some presentation you are going to do there, make some connections there. तो इसमें भी travel रहता है. MSL में भी बाहर जाना पड़ता है, But ये जो companies भी है ना इंडिया के अंदर, they give preference those have under 40. I can say in India. Arindam, are you here?
And what?
Yes, you want to add something, Arindam?
Sir, how much long you are this training? How much long?
Yeah.
Duration of this training?
4-month course. Our is a 4-month course.
4-month course and fees for it?
Yeah, that will be Arindam. So there is basically this is a super 30. We are going to give admission only for 30. So there is a 4-step process to get into enroll in this course, And after that, the fees and we also have even loan facilities. You can pay in 12 months, you can pay even in 2 years, 24 months पे आप pay कर सकते हो. वो सब चीजें हमारे पास में. But you need to go through this process. There is, I think Dr. पहले आपने एक्सप्लेन किया था एडमिशन वाला जो क्राइटेरिया था.
Yes, sir.
If you want, I can explain once
Maybe
more.
maybe another video, yes, you can.
Yeah. So, guys, the whole plan over here is to onboard the best talent for this particular courses. Okay. So, there are n number of skill sets required if you're actually looking to get a job as an MSL or a drug safety physician or any other non-clinical roles, right? So for an example, the selection process is based on an initial counseling session where we would like to understand on your skill sets, right? So like sir has mentioned, right, if you want to become an MSL, the primary role or primary skill set that is required is excellent communication skills, right? So we need to judge how good you are in your communication and your presentation skill sets. Along with that, what we follow over here is before giving admission to anybody, there will be a process of admission test, right? So one has to clear that test, and then there will be a round of interview. And if we feel that yes, the particular person who is actually interested in this particular course is suitable enough, right? Only then we will extend an offer, post which one can make the fee payment of fees and can enroll with us, right? The ultimate goal of for any upskilling courses to get the required transition in career, and that can only happen if the right sort of person is part of a particular curriculum, right? This being a certification course, I would like to quote, this being a certification course, anybody and everybody can actually come for learning, right? But if you're actually looking for a transition, right, if you're actually looking to get a job, there are n number of requirements as per the job description of a particular company, the key responsibility areas, the daily requirements, right, the primary skill sets. So these are stuff that we need to analyze during the admission process, right? And then only we can offer you a position in our Super 30 batch. The sole reason being the legacy of this company, where we have already transitioned n number of lives who are looking to move abroad, and the same needs to continue even with the upskilling courses. We only want to onboard people who can be transferred or can be given a placement opportunity where they can actually work. Okay. So basic step, right after the webinar, people who have shared you the link will get in touch with you from our counseling team, and then there will be an admission test, post which you will actually be allowed to get into an interview, and if you clear that interview, you can join our course by paying the required fees. That's the admission process.
How much is the fees for this course?
Our fee
How much the
structure,
fees?
yes. Our fee structure for these courses are 1,50,000 plus GST, which is 18% in India. And for the international students, it is 3,000 AUD plus 10% GST as per the Australian norms. Okay.
1,50,000. 1,50,000.
1,50,000. Yes, exactly. Plus
Right.
GST.
Plus GST. Okay.
Correct.
Hmm.
I hope I've answered your question, Doctor.
Hello.
My question is, what is the scope of this qualification in India? What is the scope of this additional qualification
I think
for
there are
MBBS?
too many people. Just hold on. I think there are 2-3 people who are speaking at a time. Guys, please mute yourself. We'll address all your queries, but one person at a time. I think it will be easier for us. Yeah.
Yes,
Can I?
everybody,
I
just a
have a
small
question.
announcement for all of you all. As we have mentioned, it's a small request. Okay, we can see your screens. If you have raised your hand, your names are popping up on my screen. I'll be calling out your names, but only once, because what happens if one person is asked a question, probably you also get an answer, right, to that question. So please listen to that, and then after that, you can ask your questions. All right. So I think sir's question is answered. Let's move on to Dr. Ravi Shankar. Dr. Ravi Shankar, your question, please.
Hello.
Hello.
Hello, ma'am. I'm audible.
Yes, you are audible.
My question is to Dr. Akram, sir. I'm MBBS graduate. I secured a NEET PG seat now. I got MD pediatrics.
Yes, yes.
Yes,
Tell me.
Dr. Ravi, go on.
I got admission in MD pediatrics. I want to shift to Australia immediately after finishing my residency here in India.
So you are in year one right
Year
now?
one, sir. I'm going to join.
Going to join this year?
Already secured admission. Academic
Yes,
session need
understood,
to
understood.
start.
Okay, okay,
So
okay.
I'm looking for AMC standard pathway.
Yes,
I'm planning to take course and planning to give exam next year.
yes.
Not now.
Dr. Ravi,
Next year ending.
so I can say the right time for you to start preparation for AMC one and simultaneously clear your, pediatrician pediatrics here in India and try for the job in Australia as a RMO, SRMO. Most likely you will get as a RMO or SRMO position आपको मिल जाएगा यहाँ in pediatrics only.
Okay.
Yeah, you need to pass this AMC one plus English and then you can start working there.
Okay. Thank you.
Thank you so much, Dr. Vishnu. Sorry, Dr. Ravi Shankar. Next is Dr. Vishnu
And
Vardhan.
please wait, our team will get back to you one-on-one, so they will guide you each and everything. Yeah.
Right.
Hello,
And
I'm
also,
audible.
guys, certificates. You all can download your certificates if you want. The link is on the chat box. Yes, Dr. Vishnu, please continue.
My question is to Dr. Akram. Sir, I have seen the webinar. As mentioned, most of the roles they mentioned the qualification required is MD or MS.
Yeah.
I mean, does the MBBS graduates have an opportunity, scope or growth here to
Yes,
get a
yes.
job?
I mean, this is the minimum requirement is the MBBS only, and sometime, there many of the nowadays, MD, MS वाले भी shift कर रहे हैं. So MBBS is enough है, growth के लिए भी.
And another question, sir, is having a clinical gap is a problem to get a job in this thing?
So you are FMG, Dr. Vishnu?
Yes, doctor. I have texted you, yeah.
Okay. So have you
Regarding
are you
aims also
currently
texted
working
you.
somewhere और कुछ करते नहीं करते आप?
हाँ, sir. I'm actually right now working as a medical reviewer in the in US healthcare system.
Okay, very good. तो आपने ड्रग सेफ्टी फिजिशियन मेडिकल रिव्यूअर आप ऑलरेडी वर्क कर रहे हैं, right?
Yeah, it's like I don't know. They said it's a medical reviewer, but I'm doing something else. I don't know what to tell regarding the job which I'm doing right now.
Maybe I will connect you, separately, Dr. Vishnu. Then we will guide you, ठीक है?
Sir, regarding AMC also, I have a question, sir.
Yes, please.
Yeah, I graduated in 2022. I have 1 year clinical experience in hospital, but that was not, I mean, that was under the table job only in hospital. I was working, they didn't give any certificate
आपने
for
FMG
me.
पास किया नहीं किया? Not yet.
No, I haven't passed my FMG,
Yes,
but I
so
worked
you
in
cannot
hospital.
say you have clinical experience because clinical experience you only can say once you are RMP in your home country, So ये जो experience है, it can help you to get a job in non-clinical, but clinicals में थोड़ा सा difficult रहेगा because आपका experience है ही नहीं. Now,
Yeah.
even if you pass AMC exam, difficult रहता job मिलना because you do not have any clinical experience. So what you do, you need to basically improve your CV. CME, CPD points को include करते जाओ, ALS, BLS करो वहाँ पर. Even if you can try to go to do some observership in Australia, in that way you can, improve your chance to get a job in Australia.
Okay, sir. Thank you.
Thank you, Dr. Vishnu.
Thank
Hello.
you very much, Dr. Vishnu.
Hello.
I'll come to you, doctor. I'll come to you. Okay. This is we are going through queue by queue. Okay. We will
Yes,
take
guys, we are here till 9. तो जितने भी लोग सबसे बात कर गए हम लोग जाएंगे ना, please one by one. Yes.
Yes. Next is Dr. Varda Niyamat. Dr. Varda, your question, please.
यस मैम, थैंक यू सर.
welcome.
मैं पाकिस्तान से हूँ. मैंने ये पूछना था कि हम लोग भी लाइक अप्लाई कर सकते हैं ना इसमें? ऐसा कोई है तो नहीं है कि आप नहीं अप्लाई कर सकते?
रोल फॉर वी आर टॉकिंग अबाउट जो इंडिया में कंपनीज यहाँ पे हायर करती हैं CROs वगैरह. सो आई हैव नो आइडिया रिगार्डिंग पाकिस्तान में ये कंपनीज है या नहीं है, सो आई कैन नॉट कमेंट ऑन दिस. बट यस, इफ यू वांट टू गो लाइक अब्रॉड तो AMC आप कर सकते हैं. एंड दिस इज अ प्लेटफॉर्म with us 82 countries से बच्चे enrolled with us at academically. So this is not something, you know,
Yes.
non-clinical role में I cannot think anything, you know, हम help कर पाएंगे पाकिस्तान के अंदर.
सर मैं आपके साथ ही पहले इधर एकेडमी में ही ना एएमसी के लिए मैंने अप्लाई किया हुआ था, लेकिन अनफॉर्चुनेटली पैसे ना होने की वजह से मैं नहीं मीट अप कर सकी क्राइटेरिया को, और मैं उसी की लिहाज से ना इसमें मतलब एनरोल होना चाह रही हूँ. तो मैं इसलिए कह रही थी कि इसमें अगर मैं इसका पहले एक टेस्ट होगा आपकी इधर इंडक्ट होगा,
Yes, yes, वो तो that secondary, you know, वो सारी चीजें पूरा एनवायरमेंट का है. बट हमें वी आर ट्राइंग टू लैंड ए जॉब इन इंडिया. जो हमारे इंडियन बच्चे हैं हम उनका ही जॉब का हेल्प कर पाएंगे. वी कैन नॉट हेल्प यू इन योर कंट्री बेसिकली फॉर द जॉब. प्लीज जस्ट गिव अस सम टाइम. टुमारो आवर टीम विल गेट यू वन डे विल गाइड यू. ठीक है. Yes, Dr. Sonal. So, Saif, Haq, can you please unmute?
Yes, hello. Good evening, sir.
Good evening, Saif.
Yes, sir, I have a question regarding this itself. I'm already like with academically preparing for AMC. I have given AMC this like in 2025 May, but unfortunately couldn't clear it for just some marks. So again, I'm planning to write it either in March or April. But while preparing, I came across this non-clinical part. So what I'm really after at this moment is how. Sir, Kolkata में रहता हूँ sir.
Okay, very good. ठीक है. So I can say first of all, please try 100% for this time for AMC. ठीक है?
हाँ जी sir.
But meanwhile, if you are thinking that you are good for, you know, if you want to go for non-clinical, definitely we can help in this as well.
हाँ जी सर, क्योंकि मुझे ऑस्ट्रेलिया मूव करना है, तो ये इसके साथ ये जो एड ऑन एक सर्टिफिकेशन होगा, ये जॉब आप जैसे कह रहे हैं कि इंडिया
इसमें वीजा नहीं मिल सकता. इसमें क्या होगा, you need to work in India for certain years, maybe 2-3 साल में. Might be later on the company can sponsor you the work visa. तो बी ऑप्शन अपनी हो सकता है, नो, अगर आपका ये ऑप्शन तो एएमसी के थ्रू यू कैन गो टू ऑस्ट्रेलिया. और सर आर यू एफएमजी हो आप या कहाँ से हो आप?
एफएमजी हो सर.
अच्छा अच्छा, है ना. तो पहला तो प्राइमरी एम रखो अपना एएमसी वाला ही, एंड सेकंडली ये रख सकते हो आप तो कि आप अभी से कुछ नहीं हुआ, एएमसी नहीं हो पाया, तो फिर आप यहाँ पर जॉब करना चालू कर देना. 2-3 साल में डेफिनेटली यू कैन ट्राई एटलीस्ट आफ्टर 1 year एक्सपीरियंस. तो कंपनी कैन गिव द प्रेफरेंस टू हैव सम एक्सपीरियंस बेसिकली.
अच्छा अच्छा, मतलब ये जो सर्टिफिकेशन होगा ये कोई भी वो अभी जो आ रहा है कि वीजा सब क्लास 189 190 के अंदर नहीं आएगा ये?
नहीं, दिस इज नथिंग वी आर टॉकिंग अबाउट द वीजा.
नो आई एम सेइंग कि अप्लाई करने के लिए जो ऑक्यूपेशन लिस्ट आया है, नहीं उसमें
भाई उसका असेसमेंट होता है. यू कैन नॉट अप्लाई. डॉक्टर इज नॉट एलिजिबल टू अप्लाई. डॉक्टर मालूम है कब होगा एलिजिबल टू अप्लाई? 189 या 189 या 190 या 491. यू नीड टू पास एएमसी and then work for 1 year as a RMO in Australia or as a GP or as a specialist. Then you need to apply to Medical Board of Australia for the assessment. उसके बाद आपको PR मिलेगा. जो पहला जॉब होगा ऑस्ट्रेलिया में आपका वो वर्क वीजा पर ही होगा. कोई ना कोई हॉस्पिटल आपको स्पॉन्सर करेगा.
अच्छा अच्छा, ठीक है
ठीक है सर. वो 189 190 इज नॉट फॉर यू एट दिस मोमेंट. वो बाद में आपका नंबर आएगा. ठीक है.
हाँ जी, ओके सर, थैंक यू.
थैंक यू डॉक्टर सर.
Thank you, Dr. Saif. Dr. Krishna, your question, please.
Hello, sir. First of all, thanks for this webinar.
Thank you, Dr. Krishna.
Yeah, sir. I am from Chennai, sir. I just completed my Form D and postgraduate diploma in regulatory affairs, sir. So I just want to become a MSL, but comparatively PV or RA, the openings for MSL is very less, sir. So can you guide me how to get enter into MSL, sir?
Particularly in medical affairs, there is so many different departments, you know. So you can get enrolled in this course if you are eligible. We have and then we will guide you. So definitely openings are less, but lot of companies is here. So you can go to jobsly.com. You will find lots of jobs is there. So Jobsly is a one-stop solution for all healthcare jobs. This portal only for healthcare professionals. So you will find hundreds of jobs is there. Jobsly.com.
Okay, sure, sir. I will check, sir. Sir, and I am more passionate and I'm looking to only to become a MSL. Sir, could you please connect me with your team by
Sure,
tomorrow?
sure, sure. Arindam, can you please correct someone to the Dr. Krishna?
Sure.
Yes, sir.
Asad,
Thank you.
how to get your link? Did anybody call you for the invitation or
Dr.
did
Krishna,
anybody?
are you connected to anyone from Academically?
No, sir. I checked randomly and I joined in your channel, sir.
Okay,
Okay,
okay.
okay,
Just
okay.
wait. Our team will get you to today or tomorrow. Okay?
Yeah, sure, sir. Thank you, sir. Thank you so much.
Thank you, Dr. Krishna. Welcome.
Next, we have Dr. Prateek Saha. Your question, please.
Good evening to everyone.
Good evening.
I'm doing my MD pharmacology. I'm in my first year of residency. So I just had a query that say if I take up this course right now, I clear the exam and I take up the course and I complete the course also. So what about the job opportunities? Do I get the job assistance when I finish the course after my MD pharmacology, or at that point of time I won't be getting any assistance in that
No, definitely we will give assistance, अगर आज में बाद में भी आप आते हो, but आपने अगर कर लिया होगा, हम आपको इतना गाइड कर देंगे कि आपको जॉब खुद ही मिल जाएगा, हमारा नीड नहीं रहेगा at that time.
Sir,
आप
I would like to interrupt a bit. I'm doing my MBA also in healthcare. So
you are doing MD year 1, yeah, right?
MD year 1 in MD pharmacology, and
Yes.
also I'm doing my MBA. MBA, it's like the last semester is there. So,
but your valuable degree is MD.
yes, absolutely, absolutely, sir.
So
Yes.
MD में your degree is very valuable, and उसकी बेस पे आपको job मिलना है basically, wherever you are going.
Yes,
So
yes,
you can
yes.
join even Dr. Prateek, I don't know किस medical college में. Maybe you can.
I'm in Kempegoda Institute of Medical Science, KIMS in Bangalore.
Okay, in Bangalore. Okay, okay. So I have no idea कितना workload है वहाँ पर. Even you can try full-time job in medical doctor physician, work from home पर और साथ में आप MD करते रहो, वो भी उसका आपके लिए.
So that would be an opportunity also. That would be a lovely opportunity.
Yes.
Also, sir, I got a ideation from the person who contacted me that we will be given some internship program about this. So in the
right
internship,
now हमारे 3 managers in Bangalore में घूम रहे हैं. We are trying to as much we can to हमारा ये first batch है. We will try 100% सबका job लगवा दें हम, ताकि हमें और बच्चे मिले, right?
सर
So
मैं
we are
समझ रहा
trying
हूँ,
our best कि किस कंपनीज में इंटर्नशिप होता है, हम जॉब लगा पाए आपका.
I understand, sir. Thank you so much for this webinar. I really appreciated what you have done, sir, for us.
Yes. So I think please connect Arindam also connect to Dr.
Can I ask a
Sure,
question?
guys.
I have to get to work.
Guys, I'm sharing my phone number on the chat over here. Anybody who wants to get counseled right now can ping me. Okay, I'll assign a counselor right away.
Dr. Yes, Ashwini Salve, can you please unmute?
Dr. Ashwini?
Salve?
Yes, sir, I'm here.
Yes.
Sir, I recently finished my MBBS. Actually, 2 months over, I got finished my internship. I'm looking for some best opportunity, more than 20 lakh per annum opportunities in this field. So is it possible, sir, like even foreign
Definitely in
opportunities
a
also?
40 be possible, but it might be not in a day one, because you are a fresher. Company need to invest some time, आपको teach करें, and then maybe you can, after some 1 year के बाद में you can expect that much salary. But at day one पे I cannot say कि आपको 20 lakh कोई pay करेगा for MBBS in India.
Okay. Do I get jobs immediately after finishing this
Definitely, you
course?
need to start working, and along the way, definitely you will more than 20 you can make.
Okay, sir.
Thank you, Dr. Ashwini. So,
Sir, can I ask my question because I have to get to work?
Manager for admissions, please get in touch with him. Number डाला हुआ है ये chat box के अंदर.
Yes, please ask your question, dear.
Okay. Hello, everyone. I'm Abdul Basit. I'm from India. I completed my MBBS, my anesthesiology in both of them in Ukraine. Then I did not do my FMG, but I did work in a hospital for a year. Then I did my public health in London. Now I'm looking for non-clinical backup opportunity while I'm working for a GMC registration parallelly.
Yes, Dr. Abdul. Sorry, I was not here. Can you please repeat again? आपने MPH किया है UK से, right?
हाँ, MPH यूके से किया हुआ है सर, और MBBS और MD दोनों एनेस्थीसियोलॉजी में MD किया हुआ है यूक्रेन से, FMG दिया नहीं।
ओके, वेरी गुड। तो आपको नॉन क्लिनिकल में जाना है, राइट?
हाँ,
तो
पैरेलली आई
अभी
एम
आप
वर्किंग
यूके में हो,
टुवर्ड्स माय
इंडिया में हो, आप
GMC
कहाँ हो?
रजिस्ट्रेशन। अभी यूके में हूँ।
कौन से आप लैब 2 क्लियर हो गया आपका?
अभी प्लैब तो नेक्स्ट मंथ लिखने वाला हूँ सर।
ओके। तो अभी जॉब आपको इंडिया में करना है या उधर यूके में?
आई डोंट माइंड एनीवेयर सर।
यू नीड टू बी इन जॉब जो होगा, हम लोग हेल्प कर पाएंगे इंडिया के अंदर मोस्ट लाइकली, ठीक है?
ओके, नो इश्यूज सर। इंडिया वापस आने से अच्छी बात क्या हो सकती है सर?
तो डेफिनेटली यस, वी कैन हेल्प। आपका वेरी गुड प्रोफाइल है आपका।
हाँ।
So everyone please also connect to
So
the
what kind of roles will you suggest sir?
So since you already done, MD, अगर आपका you able can try for MSL is a good role for you. Medical advisor के लिए आपका जो है एक very good profile है आपका, and yes, yeah, ये तो profile आपके लिए बहुत अच्छा है because since you are very young, तो ये profile is the best suitable है आपके लिए।
Okay. And sir, ये जो आपका कोर्स है, is it CPD accredited?
नो, CPD तो नहीं है यार, इंडिया में तो अभी कोई ऐसा वो है नहीं, हमने accreditation नहीं लिया हुआ है, but we will try later on. Basically our aim to help you to land a job. ये सर्टिफिकेशन तो कुछ नहीं होता यार, सर्टिफिकेट ले लेकर लोग घूम रहे हैं, राइट?
Yeah, that's true. अभी देखो ना सर, मेरे पास ही 3 है। I have 3 of them, but still of no use.
मैं वही बोल रहा, हमारा काम है जॉब लगवाना यार। ये सर्टिफिकेट बांटते रहे, CPD पॉइंट, CME पॉइंट को यूज तो आप अपने CV में लिख लोगे बस, राइट?
हाँ, that's all.
बट हम एक्चुअल चीज को बिलीव करते हैं, आपका जॉब लगवा पाए, इंटर्नशिप लगवा पाए, वो उस पर हमारा ज्यादा फोकस है।
Okay sir. Sir, if I am getting into an entry level route पे अगर जा रहे हैं, so how much can I expect to be the pay?
जनरली जो MNC ने बहुत ही हाई पे करती है, 20, 30, 40, 50 भी हायर बुक पे करती है, so
वो तो बाद में ना सर, एंट्री लेवल पे पूछ रहा हूँ।
I think 15-18 you can expect at least minimum.
Okay. Yeah.
Okay.
सर मेरी ड्यूटी स्टार्ट करने वाली है, क्या मैं बोल सकता हूँ क्या?
Yes, विकास प्लीज।
या थैंक यू सर। सर मैं डॉक्टर विकास हूँ, FMG के हूँ सर। 18 ईयर एक्सपीरियंस है मेरा 47 ईयर एज है सर। तो मैं ये कोर्स ज्वाइन करना चाहता हूँ सर, ये MSL वाला। तो बेटर कौन सा रहेगा सर, ये फिजिशियन फॉर्म वाला या ये?
आप कहाँ से हो इंडिया में?
दिल्ली से सर।
अच्छा, दिल्ली में हो तो आई मीन इफ यू आर वेरी गुड योर कम्युनिकेशन है तो फिर MSL पे, अदरवाइज जस्ट फिजिशियन पे आप चले जाइए।
नहीं, कम्युनिकेशन स्किल तो बहुत अच्छा है सर मेरा, बाकी मैं 18 ईयर से 100% प्रैक्टिस में ही हूँ।
अच्छा, तो फिर आप इसकी दोनों के लिए सब्सिटेबल हो। दिल्ली में तो हमारा ऑफिस भी है गाइस, इन नियर दिस ग्रीन पार्क मेट्रो स्टेशन, जो गेट नंबर 3 के बगल में हमारा ऑफिस भी है, वहां पर भी यू कैन गो एंड मीट देयर।
तो सर कोई किसी से कम्युनिकेट कर सकते क्या, ताकि मैं मिलके, मतलब मेरे लिए बेटर कोर्स कौन सा रहेगा सर, 3 मंथ्स वाला है या कौन सा वाला?
डॉक्टर विकास
हमारे 4 मंथ के ही हैं।
4 मंथ्स के है।
Yeah, I've called Dr. Vikas, so I'll speak to him.
Yeah. Dr. Mrinalini, we can also ask Dr. Nishtha once. Dr. Nishtha, you're there. If you can just answer this question.
Yeah, sure.
Yeah.
Regarding what will be the best for him, right? Which course will be the best for him?
Yes.
So, like sir mentioned, if you would like something that involves travel, communication, and research work, post-marketing, so MSL will be good. You will get a medical advisor job also directly, because clinical experience is good enough. Only travel will be there if you're comfortable with that travel.
I am comfortable with everything, ma'am.
Yeah, so then there's good opportunity in that. Second option is drug safety physician. The advantage over there is that you have clinical experience. So you are MBBS, MD. What did you mention?
MBBS, ma'am. I'm done from Ukraine. So degree is my MD physician.
Okay, all right. So post MBBS or post MD, both the things, you have good opportunities in drug safety physician, and that 18 years clinical experience will also count in drug safety physician. So along with the degree, this will make you stand out. You have a good chance in both. I would suggest maybe if you do the assessments, it will be better, because you have a good chance in both and you'll do well in both.
And the package is also, there is both same or something else?
So more or less it's the same. The future growth will depend on how you perform. But yeah, generally for an MSL MA, for an MA you can expect anywhere between 15 to 18. Uh, for some people it can start at 20 also. And for drug safety physician, around you can expect the same. Drug safety physician, you will have a lot of gap. You know, some people are offering 12 to 15. Some companies are offering up to 20 starting. So it will depend from
Okay.
company to company also. You know?
Okay, okay.
Yeah.
So can we talk tomorrow for this further assessment or?
Sure,
Yes, yes,
sure,
yes,
sure,
विकास
sure.
आप प्लीज वेट कर लीजिए। कल को
जी
हमारा टीम प्रेस
I
करेंगे।
think Dr. Vikas, Sakshi will get in touch with you right
Hello,
away.
Akram sir. Hello.
जी
He
सर।
will, he will text you on WhatsApp, and you guys can schedule a call whenever you are free for the next process.
Hello.
ओके सर।
Yes, yes, thank you.
Hello,
थैंक यू सो
can I
मच सर।
हेलो
ask
सर,
my
क्या
question? I
एक
need to
क्वेश्चन
get
है
back to
मेरा एक क्वेश्चन
Mrinalini.
है सर। हेलो,
गाइस
अभी
वन
मैं
बाय
फार्म डी इंटर्न हूँ मैं सर, लास्ट ईयर है मेरा फार्म डी का।
हाँ,
तो मेरे लिए कोर्स रहेगा बेटर या कुछ इसमें बताइए सर, 1 मिनट प्लीज।
फॉर फार्म डी यू ओनली कैन ट्राई फॉर HEOR और ये MSL वाले में ही है। रेस्पेक्टिव फिजिशियन इज नॉट फॉर यू, दे नीड वेरी गुड
ओके।
फिजिशियन, एक्चुअल फिजिशियन।
ओहो, थैंक यू सर।
थैंक यू।
Thank you, everyone. Thank you. Next,
Hello,
let's move to 1 second, Doctor.
hello, ma'am.
One
Can
second.
I ask my question, please?
Yes, yes, yes. I'm coming to you. So basically, there are many people who have raised their hands जो 15 मिनट से hand raise करके बैठे हुए हैं.
यस,
But
वन बाय वन
we are not
सबका नंबर
following
आए।
you. एक एक करके हम आते हैं. We will answer your question. This is a request, sir. Okay.
यस,
All right. Next,
KMS
KMS, your question, please.
Hi, am I audible?
Yes, yes, you are.
Okay. Thank you for this presentation and everything. I have a question that during registration, I have seen PhD life science. There's a lot of talk about medical and healthcare. And what about the PhD life science? I have a PhD in microbiology, not medical microbiology, general microbiology,
या
and I have post PhD 8 to 9, more than nearly 9 years of experience. So, is there any opportunity in Australia or something?
फर्स्ट ऑफ ऑल
What,
दिस इज
what
वी
would be
आर
the path?
नॉट हियर फॉर ऑस्ट्रेलिया, दिस इज
Oh, I'm
फॉर
sorry. I
जनरल
mean,
इंडिया
whatever.
में जॉब्स की वी आर टॉकिंग अबाउट, यू नो।
I
यस, यू
understand.
कैन आल्सो ट्राई फॉर MSL में PhD को हाईली प्रेफरेंस दिया जाता है, यू आल्सो कैन ट्राई इन दिस।
Mm-hmm. Hello.
MSL और HEOR में यू कैन ट्राई, या।
Okay. Okay. So, it is the route for the.
Yes.
डॉक्टर
Thank you, Dr. KMS. Let's move on to Dr. Sadhna Sharma.
Good evening, ma'am. Am I audible?
Yes, yes, yes.
Ma'am, my question is for Dr. Akram and maybe Dr. Nishtha can also add into it.
Yes, yes.
Ma'am, I want to ask that actually I am halfway through of my preparation for NEET PG, so I don't want to drop this idea to appear and get a non-clinical seat, maybe pharmacology in the next year. But I want to parallelly also be engaged with the MSL or drug safety physician course so that I can have a more surety about my, job opportunities in the future. So I want to ask her that is it a good idea to side by side, prepare or get into MD, and also you can go for a work, home-based work for that drug safety physician course. Something can work up like that.
Yes, Dr. Nishtha, can you please take this question, and I will also add on.
Yes, yes, sure, sure, sure. Yeah, I would suggest that if you're preparing for NEET PG and you get some time alongside, this course will certainly help you. Well, this can help you get a position for a drug safety physician or MSL. And supposing you get an MD in Pharmac seat as well, this will give you an added benefit to that too. So it will be a dual experience, what you study in MD also, plus what you study in this course. This course will help you during your MD in Pharmac as well, because some part of the Pharmac curriculum includes MSL role, but not in detail. So you will be a step ahead of your other MD candidates, your colleagues. Certainly, it will be helping in both the aspects, whether you do MD after NEET PG or whether you practice directly as a drug safety physician or MSL.
Ma'am, actually, I have a personal issue which I want to share because I just completed my MD, MBBS MD age of 36. Last year only I completed. Before that, I was into food technology academic background. So my query is that I might turn 40 in January and I might lose the opportunity because they just mentioned the age limit, upper age limit for 40 years. So will
No,
it
no
cause me
problem.
any
No problem. You are 36, no, now. So even if you decide to join a drug safety physician role will be more suitable for you, is what I feel. Because that's a remote role and plus you have some clinical experience. In fact, they're looking for people between 30 to 40 as well. And even if you cross a little 40, like I have a colleague, she's 41. She's working since the last 3-4 years. She transitioned into pharma just 3 years ago when she was 38, 37. So it shouldn't be a problem. And you'll get good time to get experience also in the next 1 to 2 years.
Okay, thank you, ma'am.
Okay, thank you.
Thank you. Let's move on to Dr. Vikram. Dr. Vikram, your question, please. Dr. Vikram?
Hello, ma'am. Good
Hello.
evening, ma'am.
Good evening.
Ma'am, actually, I am Dr. Vikram. I have completed my MBBS degree from Tamil Nadu.
Mm-hmm.
Now I am working as a physician reviewer in American-based company in Chennai. So I
Yes.
would like to switch my career to career as a drug safety physician.
Mm-hmm.
So what are the actually any eligibilities for join for this course?
For this academically course eligibility, yes, we had already shared with you, right?
Okay.
MBBS and MSc. Yeah, so you are eligible, doctor. You can apply.
Okay, ma'am. Actually, what's the initial level salary for drug safety physician?
I think Dr. Nishtha can answer. Dr. Nishtha?
Yeah, it can range anywhere between 12 lakhs to 20 lakhs. This I'm talking about start. It will depend on your knowledge, whether you're an MBBS, you're an MD. MDs will have slightly higher, definitely. For an MBBS, it will depend on the company also. So it can start as low as 12, it can go as high as 20. The starting salary that I'm talking about.
Okay, ma'am. Okay, ma'am. Ma'am, what
Thank
are the
Yes.
what are the upgrade chances for drug safety physician nowadays?
There's a lot of scope, honestly, because drug safety physician role can be taken up only by a medico. So that
Okay.
way, we don't have a lot of MBBS, MD graduates, who want to get into these roles. So there's a lot of scope because everybody just knows about clinical, that's more spoken about. Not many people have ventured into this due to lack of awareness. So definitely there's a lot of scope. And like Dr. Akram has mentioned, Dr. Sonal also, the company academically as an institute will prepare you for placements, not just for the course. They'll make sure that you get through in the right place.
Okay, ma'am. Thank you so much.
Thank you so
Thank
much,
you.
Doctor. Dr. Dilip, your question, please.
Yeah, hello, good evening to everyone. Uh, I'm in emergency and critical care medicine since 20 years. My age is 49, and similarly, as Dr. Vikas, I think earlier he asked the question, I have done my MD physician from Russia, and later on in India, I did my fellowship in critical care. So I just wanted to ask which job role or profile will be suitable for me. I think the doctor just answered the
Oh,
question, drug safety physician,
Yeah,
and
Dr. Nishtha, your question,
yes,
doctor.
yes. Are you an RMP? You have a registration number in India?
yeah, I have registration. I am
Perfect.
working in different hospitals since 20 years.
Okay. So I have a question for you to understand better. Do you like giving presentations? Are you a very dynamic person? Would you like to travel?
Yeah, since 8 years, I am here teaching the nursing staffs and junior fellow doctors the ACLS and BLS and different medical topics.
Okay, so that way even medical affairs role is suitable for you. Although I understand the age is a little bit on the higher side, but
Yeah.
given the past experience you already have and given the dynamism teaching experience you have, that will further add to your criteria for the medical advisor affairs role. Because if you love teaching in the medical affairs role, you might have to teach other candidates about new drug discoveries, including the training team. You'll have to train the pharma teams as well within your company, And plus, you will have a lot of conversations with the key opinion leaders. For example, if you're working on a hemat-onco drug, conversations and discussions and advisory boards with the top oncologists in the country. There'll be a lot of conversations, discussion, and exchange of ideas. So if you like something like that, then medical advisor, medical affairs will be good. Versus if you're looking for something remote, which is very manageable, balanced, like 8 hours a day, that too allowing you gaps during the day so that you get some time for yourself at home, then you can think of drug safety physician.
Okay. Just another question. What did you tell? What will be more fit to me?
Given your
Medic
medical affairs, you can try
medical
medical
affairs.
advisor
So,
role. Yes.
can I know the salary range in that field?
So salary range, it's going to start from 15. 15 is the base salary that most companies start with. Starting can range anywhere between 15 to 20. It will depend on the type of company, but yeah, I mean, if you have past clinical experience as well, plus a medical degree, starting should be ideally somewhere around 15. Minimum, I'm saying.
Okay. Okay. Thank
Yeah.
you.
Thank you. Next, let's move on to Dr. Sameer Patwa.
Hi, good evening, everyone. I had a question like I'm a FMG. So right now I'm preparing for FMG. So is it eligible for us?
Okay, so for the FMG, I believe Dr. Sonal, probably Dr. Akram can answer regarding the.
No, I think he's asking about the MSL course. Is he
Yeah, yeah.
eligible?
Okay, okay.
Yes, eligible. Yes, Dr. Nishtha, yeah.
Okay.
Okay.
Uh, that's what I want to ask. And one more thing, I have a question. Like digital medicine, I think I heard while giving the presentation. I think another ma'am was there. I forgot the name, but I heard about something digital medicine. What is that? Digital health. I'm sorry, digital health.
I think Dr. Mrinalini can answer this
Yeah, yeah,
question.
exactly. I wanted to know
Yeah.
about that.
Hi everyone, thanks for the question. So, digital health, just like medical affairs, is a huge panorama on its own and has got a lot of small sub-specializations in it. So, there could be some, like, for example, I have a specialization of environmental and occupational health in it. In digital health, there is also telemedicine involved. But again, that is country to country dependent as well. Digital health has also data modeling. The last project that I did with data modeling was for Gemini, which is Google's AI tool, and that was for non-communicable diseases. So it's a huge panorama, and because I have a background in public health, that obviously was an additional factor that obviously made me have a better understanding of that. So that's essentially digital health. It's a huge panorama, but has a lot of sub-specializations in it as well.
Okay, thank you, ma'am. Thank you for explaining me. I was just listening this webinar very curiously. So I just heard that term. So I was very curious to know what is that. Thank you so much.
No worries. Thank
Thank
you,
you.
Dr.
Appreciate the question.
Yeah. Okay, let's move on to Dr. Saya Santosh.
Yes, ma'am. Good evening.
Evening.
I'm a foreign medical graduate from Philippines. I am currently about to finish my internship in India. I'll be moving to the US soon, like within a year. I haven't yet started my US assembly preparation, so I'm currently exploring any non-clinical pathway that could later help me in the US. I just wanted to know from your experience, like what courses out of these or any degrees further that you would recommend for someone like me.
Okay. Dr. Mrinalini, you can answer.
Sorry, could you repeat your question?
Ma'am, I'm a FMG. I'm about to finish my internship. I'm later moving to the US within a year. So currently I'm exploring some non-clinical pathways also if possible. Out of these courses, which would be more which one would be more preferred for me? So that would help me later when I go to the US.
Okay. So basically, you're looking for options, non-clinical options in the US potentially.
Yes, ma'am.
All right. Okay. So again, I think what would be very interesting is that, for example, when we do a skill assessment, tell me one thing. Again, this is a little drill that Dr. Nishtha had also done. If you're good with your communication skills, and if you are good with your presentation skills, you're okay to travel. These are basics that are not only needed within for MSL jobs within India, but also abroad as well. The same rules apply, right? So
Yeah.
if you feel that presentation skills and communication skills are spot on and travel frequency is okay, MSL might be the one to consider. If you are someone who has a huge flair for, let's say, formulas and pharmacology, or like in general, you are one of those people, then of course you can go for pharmacology. If you are those people, one of those people who has had a fair share of biostats, even during medical years, while you were finishing, because even in medicine, be it community medicine in India or be it public health in other countries, there is always a subspecialization, or so to say, a subsubject for biostats. If you have had a flair for biostats, then health economics, there is a role for that, for health economics oriented research role. For that, we have a tailored course. That is something that you can definitely consider. The courses that we are offering are not only limited to the roles in India, whereas we can provide more career-oriented support for roles within India through these courses, but these courses are open. Their knowledge can be transferred to other countries as well. However, obviously, if you are within India, the additional experience, the work experience within India will definitely help you in other countries as well, as it's a general fact, and no offensive intended. Experience in low and middle income countries is an added benefit even in tier 1 countries, 100%.
Out of these, ma'am, which is more in demand in the US? I would like to know if anybody could help me with that.
I think Dr. Akram can also pitch
Yes,
into that. But
यूएस में MSL का very very high demand है, MSL medical affairs का.
Oh,
You can,
okay.
yeah.
Okay, sir.
Yeah,
thank you.
in fact, in the US, they are hiring PharmD graduates for the MSL role in a great frequency. So
Yes,
you as an
see, Dr.
MBBS,
Nishtha,
yes.
that PharmD is totally different from India. वहाँ PharmD
okay.
is like 4-year degree after undergrad, you know. तो
Uh-huh.
वहाँ को थोड़ा एक अलग लेवल पर है. इंडिया में क्या है, जो PharmD है आफ्टर 12th 6 year का डिग्री है ये.
Okay, okay, interesting.
यूएस में मैक्सिमम जो MSL होते हैं वो
They are-
MD या PharmD, right?
Yes, yes, yes. Yep. Medical writing and clinical research also options you can consider. Medical writing.
Ma'am, if I do a course in MSL, like, will it be can I apply for jobs once I go there with the degree, or like, will I need a work experience here?
Basically, try first to work sometime in India. कोई भी आप course करें, whether it is physician, MSL, even clinical trials, या कोई भी, get some experience in India, and then once you move in US, for example, after 1 year or something, then you can try. Definitely, it will help you.
Oh, are these similar courses available there also, sir?
Hello.
Yes, yes.
Yes. Okay. Okay. Thank you, sir.
Hello, Akram sir.
Yes,
Thank
please,
you.
one by one. Who's next, Dr. Sanal?
Sir, Dr. Ghayas Mohammed.
Dr. Gyas, can you please unmute?
Dr. Ghayas, your question, please. Okay.
Yeah,
Yes.
sorry. Hello. Assalamu alaikum, sir. Sir, I have a question to Dr. Akram, sir, and Dr. Nishat, ma'am. Firstly, to the Dr. Akram, sir, regarding your webinar, I had heard everything. So I just have doubt for joining the course. We will be having the exam and then interview, and there will be selection, right?
Yes.
Yeah. So it will be like online or offline, sir? Like how it would be?
Online. Everything is online because we want to give only for 30 people admission in this course. Okay? And we will try to place for everyone. So it's super 30 batch hai, and we sub online hai, nothing offline.
Okay, that's as I'm actually myself actually Dr. Gayas. Actually, I'm an FMG graduate, sir, passed out in 2019. I didn't clear my FMG exam till now. So right now looking for as I'm like completely new to this non-clinical course. So actually I'm like interested in this drug safety physician. So I just want to
भाई
know
साहब
like
मैं कौन सा कार्य कर रहा हूँ ये बताओ मेरे लिए।
sir?
तो 2019 में हमने एमबीबीएस किया, 2025 चल रहा है राइट, 6 ईयर में अभी क्लियर नहीं किया, तो अभी आप कुछ सीवी में कुछ कर रहे थे या बस जस्ट ये अब पूरा खाली चल रहा है आपका, कुछ काम धाम चल रहा है या नहीं?
नहीं sir, I'm working as a duty medical officer, sir. In private hospitals, I'm having experience of 5 years as a
देखो
DMO.
वो एक्सपीरियंस तो लीगली यू कैन नॉट शो। डॉक्टर निष्ठा, ये
Yeah.
कोई आरएमपी नहीं है, इंटरेक्शन नहीं
Yes,
हुआ है,
yes, yes.
but he is working, you know. So
Yeah.
I mean legally we cannot say the experience basically, right?
Absolutely. We can't. Till the RMP is not registered over here, we don't count that as an experience.
Yes. So technically भाई आपका जो भी जॉब मिल जाए आपको स्टार्ट करना चाहिए। आपने बहुत टाइम वेस्ट करे, 6 इयर्स आपने खुद मेडिकल डिग्री किया, 6 साल आपने इसको पास करने में 12 साल आपका हो चुका है ऑलमोस्ट, यू नो। तो अभी ये है कि आप डेप्यूटी फिजिशियन में तो समटाइम आपको इतना गैप भी है, तो मे बी यू कैन ट्राई फ्रॉम pharmacovigilance and then so on you can move into the gradually into deputy physician or maybe MSL role path में.
Evening, sir.
So I just want to know, like, if I do this drug safety physician, is there any opportunities like to work in Dubai or any Gulf countries?
Yes, definitely रहेगी, पर भाई साहब पहले आपको जॉब मिल जाए इंडिया में एंड आप एक्सपीरियंस ले लीजिए 1-2 साल, फिर ट्राई कीजिए आप दुबई या गल्फ में भी और बहुत सारी डिफरेंट कंट्रीज में भी आप मूव कर सकते हो। बट 0 एक्सपीरियंस है आपको और कोर्स करने का ऐसा नहीं है कि भाई दुबई में आपको जॉब लग जाएगा कल को, ठीक है, बिकॉज आपको हैंड्स ऑन नहीं है इतने साल से, आपका सीवी बेसिकली अभी इतना स्ट्रांग नहीं है, लेकिन मैं तो ये बोलना चाहता हूँ आपसे।
हेलो, गुड इवनिंग
आप ये
सर।
कोर्स कीजिए, इंडिया में जॉब स्टार्ट कीजिए एंड देन ट्राई आफ्टर सम टाइम इन गल्फ।
ओके ओके, तो ये जो भी कोर्स के बारे में आप लोग मेंशन करें उसका फीस है 1,50,000 along with GST, राइट सर?
यस, वो बेसिकली
Okay,
आप
that can be done in
उसका देखो 5 स्टेप प्रोसेस है टू गेट एनरोल इन दिस कोर्स। तो ऐसा नहीं कि आपने पैसे पे कर दिए हम आपको एनरोलमेंट दे देंगे इस कोर्स में, ठीक है, ये कोर्स का क्राइटेरिया है, हर एक को एडमिशन मिलने वाला नहीं है इस कोर्स के अंदर, बट वो जो सारे क्राइटेरिया फुलफिल है उसी को एडमिशन मिलेगा। एंड फीस का तो कोई ऐसा नहीं है, इवन वी विल प्रोवाइड दैट, यू नो, लोन भी है वहां पर 12 महीने 24 महीने तक का लोन भी दे रहे हैं हम लोग, वो विदाउट पेइंग एनी इंटरेस्ट। फीस इज सेकेंडरी इन दिस कोर्स।
All right, Divyesh Arora.
Okay.
Can you please
सर 1
unmute
मिनट
yourself?
प्लीज, मैं बहुत देर से वेटिंग में हूँ।
हेलो
हेलो,
मोहित कुमार।
गुड इवनिंग सर, राहुल राज बोल रहा हूँ।
अरे
Rahul Raj,
कुमार,
go
can you
ahead,
please
please
unmute?
quickly.
Sir, we had Mohit Kumar in queue, but Dr. Rahul has told. Dr. Rahul, आप जल्दी से पूछ लें अपना क्वेश्चन।
एक्चुअली एमएसएल जो है वो फार्म डी एलिजिबल में क्या क्या कर सकता है, ये सब चीज मैं जानना चाह रहा था सर।
Okay, Dr. Nishtha, can you answer this question?
Sure. Yeah, so PharmDs, they can also have a major role in the MSL role because you will be visiting and doing certain clinical trial site monitoring bhi hoga usme, and that data you'll be presenting to the KOLs. You can also participate in the ad boards, advisory board meetings, post-marketing surveillance studies. तो ये सब में clinical research along with medical affairs, because research is a core part of medical affairs. तो आपका रोल उसमें ज्यादा होगा. Communication with the KOL and advisory board, you may not be able to lead yourself solely. We need to have an MBBS and MD doctor along with you. But definitely the clinical research part, the post-marketing surveillance studies, and certain other approvals, medico-marketing aspects, may definitely you can contribute.
मैम एक्चुअली इंडिया में क्या है इसका मतलब, वो रोल क्या है, आप अपन कर क्या सकते हैं उसमें?
सर, तो रोल ऐसा है, MSL or ME, the role is you will be generating data on the products which are already in the market. जैसे you have done phase 1, 2, 3 clinical trials, phase 4 post-marketing surveillance studies,
Yes,
generating evidence. You know, once the drug is approved, getting more evidence so that the drug has a good place in the market. Your role will be to work in collaboration with the marketing team. It's a medico marketing role, right? तो आपका बहुत collaboration होगा marketing team के साथ, तो guide them how better this product can function in the market. Okay, so that's going to,
मैम
yes.
एक्चुअली डीआरए के साथ कोलैबोरेशन कैसे हो सकता है इसमें?
DRA ka exact collaboration will be difficult for me to say because that's not my specialty. But probably Dr. Akram can add on to it if you want to combine the regulatory aspects along.
Yes, I mean, RA में हो सकता है, but भाई साहब आपका डिग्री सिंपल फार्मासिस्ट का डिग्री है, फार्मासिस्ट हो, तो आप even I did my PharmD, तो ऐसे बुरा भी नहीं मानना कि मैं, because जो बच्चे PharmD करते हैं ना, they always compare कि भाई मेरा डिग्री equivalent to MD है, तो वो भाई नहीं है, आपका equivalent MBBS भी नहीं है,
सर
फार्मेसी डिग्री। अब now इस डिग्री से आप क्या बैक कर सकते हो, तो MSL में भी बहुत सारे लोग अभी आ रहे हैं, but initially they work as a clinical pharmacist, later on they move into the what we call medication information specialist kind of role पे रहते हैं, and then gradually they move into the MSL role, so directly if you do not have any previous experience, very difficult to hire company for PharmD in India, but अगर पहले से कुछ experience है आपको या आपने बहुत किया, then definitely can.
सर एक्चुअली मैंने बी फार्म करके रखा है, उसके बाद मैं आगे परस्यू कर रहा था पीजी।
भाई वो डिग्री पूरी वो फार्मेसी की डिग्री रही आपकी, आई नो, मैंने भी डिप्लोमा किया था, फिर बी फार्म किया, फिर फार्मडी किया, तो आई नो फार्मडी पीबी क्या है, मैंने वही किया हुआ है, तो आई नो वेरी वेरी वेल, ठीक है।
यस सर, यस सर।
डॉक्टर मोहित
Yeah. Thank you all for the opportunity. Myself, Mohit Kumar. My question is a bit long, so I apologize for the long question. So I'm a graduate from Ukraine. I have done my MD physician. So coming to India, I have been registered in India. So I also have been registered in UK. But my problem is I have developed my CV up to I have 4 researches, done multiple clinical audits and quality improvement programs, and currently I'm working as a clinical supervisor where I see on conduct all the drug adverse reaction audits and all. But right now my problem is if I do this particular degree what you have mentioned, is there any transition from India to moving to AMC with the help of this GMC registration?
Dr. Nishtha, can you please take?
Yeah, sure. I'll take it up. So, Dr. Mohit, this course will prepare you for the placements. AMC registration is a different pathway altogether. That's
No. I know that. My actual doubt is, so if I do this course, I have already nearly 4 years experience in India. So I'll be doing AMC also, okay? But I want to know, after doing this course, doing job, a non-clinical job in India,
yes.
Can I transition with this degree to Australia or some other country like UK?
अगर आपने इंडिया में काम किया 1-2 साल फॉर एग्जांपल एज ए MSL, बाद में अगर आप ऑस्ट्रेलिया पहुंच गए AMC के थ्रू या जैसे भी, डेफिनेटली वहां पे हेल्प करेगा आपको लैंड करने में जॉब।
Okay, and but with this degree it works in UK?
भाई इट इज ए सर्टिफिकेट कोर्स, डिग्री नहीं बांट रहे हम लोग, राइट? इट इज 4 मंथ सर्टिफिकेट कोर्स है और इस डिग्री की बेस पे जॉब नहीं मिलेगा, आपकी स्किल्स बेस पे जॉब मिलेगा। So what we are saying, this course will help you to get into the entry level job, and based on your performance or experience, definitely will job करेगा, अब US हो, UK हो, ऑस्ट्रेलिया हो, किसी भी कंट्री में हो।
Okay.
Yes.
Okay. Thank you.
Dr. Nisha, you want to add something?
Yes, sure. So basically, it will be good to go through the AMC and start working there. But definitely, if you want to work in pharma companies in Australia, this experience that you have in India will help you over there. If you join as an MA, MSL over there, because even I have a lot of colleagues who work few years in India, and then the same MA role they've got in other international countries. Okay, so you don't need to work and give all the clinical exams again if you're looking to transition via the company. They'll sponsor you for it.
Okay. Thank you.
Yeah.
Hello, can I ask my question, please? Actually, I'm in a hurry a bit.
Yes, please.
Hello.
I guess Dr. Pavni is in next.
Yeah.
Pavni, can you please unmute, please? And next we फिर आते हैं ऊपर.
Yeah,
Guys,
hello.
I can't see you all, right? But there is a queue.
Dr. Pavni, can you please unmute?
Yes, yes. Hello all. Good evening.
Evening.
Actually, I did my Master of Pharmacy in 2018, and later on, I am having 2 years of experience in clinical SAS, and I am having a career break later. So, can I choose MSL or HEOR right now after this career break? Is there any career break? Like, is there any entry barrier for me?
Yes, you can, try it from here, but since you last 2 year gap is, a long gap, but still you can try, you can start from here.
Okay, okay. So, can I choose HEOR or MSL, which serves me better?
तो अगर
Position.
एम फॉर्म किस ब्रांच में किया आपने?
Pharmaceutics, sir.
Yes, it can be, HEOR also you can. If you love, to do calculations and all those things, then definitely can. Otherwise, you can go to the PB and others.
Okay, so compared to MSL, HEOR serves me better, sir, in my case.
बेसिकली जनरली जो HEOR में जो जॉब्स होती है थोड़ा कम होती है, नंबर ऑफ जॉब्स वेरी लिमिटेड इन HEOR, very specialized profiles, even they hired for PhDs basically in this profile, so maybe आपका career gap है, you can try from pharmacovigilance, then move on gradually. Maybe you can try for later on HEOR, maybe in MSL as well later on.
Okay, okay. So anyways, I need to have some experience in clinical research part. Then I can go into
Yes,
HEOR.
clinical research, pharmacovigilance, and then you can try, yeah.
Okay, okay. Yeah. Thank you, sir. Thank you.
Hello, sir.
Yes, Arindam, who's next?
Hello, sir.
Satish Mori, can you please unmute? Guys, जल्दी क्या है? Queue basically.
Very good evening.
और time से लोग
I'm
wait
Dr.
कर रहे हैं,
Satish
we are
Modi.
coming one by one. और जब नंबर सबका आएगा, we are here.
Hello.
Satish Mori, yes, please.
Good evening, sir. Pardon me, I'm in trouble. There will be a light voice disturbance. Am I clear to you?
Yes, 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 please.
I'm a retired naval medical officer with a 10 years defense medical exposure.
Okay.
After that, I am presently employed in a medical directorate, public health director of state government of Andhra Pradesh. Presently pursuing, hello.
Yes, yes, Doctor, continue, please.
Presently pursuing MBA Healthcare Administration and postgraduate diploma in Medical Law and Ethics from National Law University, Bangalore. Presently, I'm looking for a transition from to Southeast Asian countries like Singapore, Malaysia. What are the opportunities can I look forward?
Dr. Nishtha, do you want
Yes,
to
yes,
add?
sure. What role are you looking at? Are you looking at PV or are you looking at medical affairs outside India?
I'm comfortable in both, and I have a good background in biostatistics, and I'm good at mathematics and data analytics.
Wow, that's very interesting because that will make you a better candidate for HEOR, definitely. So you have an amalgamation of so many qualities. Definitely, as an MA, the upper hand will be your MA, MBA degree. You are an MD plus, right? You're an MD doctor or MBBS?
I'm an Indian medical graduate. I'm MBBS completed from
Basically,
Academically College,
MBBS,
which is
MBA.
located in Nishtha.
MBBS and MBA, both of this, right?
MBBS.
Yeah.
Okay, MBBS and
Ma'am,
MBA.
clarification. Can I submit one thing?
Yeah.
Ma'am, I'm presently pursuing MBA Hospital Healthcare Administration, presently pursuing both the degrees, PGD MLE from National University.
All right. So at this point, you have
Presently employed. I want to transit from here to somewhere outside India. Suitably very near location, that is Malaysia or Singapore. What are the I'm looking that kind of opportunity.
Okay, you have worked as a defense doctor, if I'm not mistaken, which you mentioned.
Yes.
Yes, I'm a retired lieutenant commander from Indian Navy.
So that's very good for the country, but going outside India with a defense background might give you some hurdles, because you have worked for Indian defense as a doctor, which is, why don't you stay in the own country? It's really nice opportunity here also, looking at the different horizons. Yeah.
there are some social commitments I need to fulfill for at least 5 to 6 years there. That's my requirement.
All right. Yeah, so MA role will be good for you because as a medical advisor, communication skills matter a lot. Given your MBBS plus MBA that you're adding to it, MBA itself means your communication on soft skills will be good, right? That will give you an upper hand, but directly going to other South Asian countries will be difficult. You'll have to first start in India, get some hands-on experience here in an Indian pharma company, and there's a high chance in few years time, I can't say how many years, for some people it takes 2 to 3 years, but some people it takes 4 to 5 years, you could get a sponsored transfer to another Southeast Asian country. I have had my seniors who worked for a few years in Indian pharma and then got transferred to South Korea. They're doing very well. South Korea, Japan, there are quite a bit of pharma companies. For drug safety physician, India is good, Southeast Asia is also good, but again, you require some background experience from India, which will make things easier over there. HEOR is not yet that developed in India, but outside India, there are more opportunities. Yet, since your degree is Indian, they might have a little bit of hesitation. So the best thing in your case would be join a pharma company over here after this course, get some experience over here, and at least if you have 1 to 2 years of background pharma experience, in other Southeast Asian countries, you have a good chance.
Yes, perfect.
And can I ask one more? Actually, presently I'm drawing something like per annum to hand. What will be the chances if I transit from the public health domain of government opportunity to private sector? What are the opportunities? Will it have a benefit from my experience, or I have to go to the
Actually, I didn't get your question clearly because there's a lot of noise in the background. Probably if anybody else understood.
Ma'am, I initially pardon for that. I'm on journey, so there is no.
Maybe Dr. Satish, maybe our team will get back to you and they will guide you tomorrow. Basically, you are in travel, so we are not able to hear your voice clearly.
Thank you, sir. Thank you. I will be in touch.
Dr. Swati, can you please unmute?
Yes, sir. Good evening. I was next to Mr. Sadish, but unfortunately, due to the bad network, I got logged out and joined again.
Okay, Dr. Alvin, after Swati, you can continue. Dr. Swati, can you please unmute?
Yes. Good evening, sir. Sir, this is my question to you and Nishtha ma'am. I am an MBBS graduate. I have 13 years experience post MBBS. I'm also a fellow in critical care and family medicine. So I've been working after MBBS for 13 years now. Currently, I want to know the best. I'll be giving my DHA to go to Dubai and practice as a GP there. So I want to know the course that I can add on as a basically working for remote. I am I have a responsibility, too many responsibilities, and I want to cut down. Till now I've been mostly working in ICUs. So now I want to possibly think about having some remote add-in job. So that is what I wanted to know, and something that could add in, as in the salary also, and also as an experience that I can later on use in Dubai.
Okay, thank you so much, Dr. Swati. First of all, we provide DHA coaching में हम लोग कराते हैं आपको GP का मतलब दुबई के लिए, so we can help you in that. But Dr. Nishtha, if you can just guide her.
I have a PG certification in healthcare management, and I'll be completing my MBA also next year. So actually, you may say that I'm confused right now what exactly to do.
Okay. So Dr. Swati, given your scenario, I feel the drug safety physician / medical monitor role will be the best for you. Why I'm saying this is because after your MBBS, you've had enough clinical experience in India itself, and the drug safety physician medical monitor role, it involves a lot of evaluation of serious adverse events, causality, association. If you have a rich clinical experience, definitely you will be a good candidate to do these assessments after a little bit of training. And the companies look forward to hire such candidates who have a rich clinical experience in India as an RMP. So, and plus this is a remote role. It's something you can manage very well because a lot of my colleagues, especially female colleagues, are doing the drug safety physician role, medical monitor role, and they're all very happy. Very balanced life. You will get time for yourself, for the household stuff. And yeah, you will certainly enjoy it. Alongside, you appear for DHA also. There's no problem. Plus, another advantage is that even if you go to Dubai, on your CV, at least it will show you've done something more productive other than clinical practice, because serious drug event reporting, causality assessment, this is an add-on thing giving you a unique perspective as a candidate for DHA also in future.
Okay. And ma'am, if like I shift from a clinical role later to a completely non-clinical role later in Dubai, so what are the chances for as a DSP?
As an MSL or a drug safety
I don't
physician?
want to do MSL.
Okay. Okay. Yeah. So clinical roles, I know a lot of my colleagues who are doing clinical roles. Some are doing drug safety physician as well. The scope, I mean, the positions are more in India, to be honest. In Dubai, I don't have a direct overview how many position opportunities are there, because Dubai is an opportune place for everything, you know, everything in healthcare. So you will have plenty of opportunities, but it will be difficult for me to say how easy it will be for you to get placed over there. But be it clinical or paraclinical, if you have both the experiences, it will really help you there. In future, if you want to transition into any role, either of the two roles, well, you have a lot of scope there.
Okay. And the DSP, like how much experience, how many years of experience should I have now to,
Now,
complete as a remote person?
Yeah, I believe at least minimum 2 years from India. It will be good. Yeah, at least 2 years, I would say. If you have 2 years experience from India, it will be easier for you outside. Yeah, for the visa process, it will be a little difficult to get direct sponsor. But supposing you clear DHA and you join as a clinician over there, and later you want to transfer to a non-clinical role, that option is also pretty much available to you.
Right. So that is the route I'm actually, I have booked a call tomorrow with the EO people. So just wanted to have this clarity from you, Nishtha ma'am. So thank you so much, ma'am. Thank you.
Dr. Akram, would you like to add to this?
Yeah, I think you already guide in the same thing, So you can try for, if you can, work-life balance, definitely is the one of the best role for you. अगर आपको बाद में जाना ही है अगर दुबई में तो you can go through the DHA exam.
Okay, sir. Actually, I'm also doing medical coding. मैं अभी बहुत ही confused
अरे
हूँ.
भाई इतना मत करो, confusing में मत हो जाओ. Medical coding है
for a remote.
हो.
So this is just a remote thing that I was asking for because
I mean definitely ने बहुत ही अच्छा. एक मेरे रिलेटिव की मैंने बताया था कल मेरी पर्सनली उनसे बात हुआ था. So she working in Bangalore. वो बोल रही थी सारा घर का काम हाउस होल्ड वो कर लेती है पूरा का पूरा काम एंड वो जैसे फिजिशियन है एंड गेटिंग सैलरी अराउंड आते हैं बताइए मतलब 25 लाख उनको मिल रहा है राइट नाउ. शी इज एमडी इन फार्माकोलॉजी तो ऐसे आपको भी हो जाएगा. तो गुड थिंग है कि आप एक पे फोकस करो पे ज्यादा मत आओ. कोडिंग में यार होते हैं फार्मेसी वाले बच्चे जो 20-25 हजार रुपए में जॉब करते हैं. इट्स नॉट फॉर यू आर बेसिकली.
ये सब अभी मैं सिर्फ टाइम पास के लिए कर रही थी बट जैसे अभी ये मैंने देखा डीएसपी का मुझे अच्छा लगा लाइक समथिंग दैट अ डॉक्टर.
यही आपके बेस्ट है. आप उधर मत जाइए, आप कोडिंग में मत जाइएगा.
जी नहीं okay sir thank you and I have arranged the call for tomorrow maybe we will be able to speak and understand.
Yes, tomorrow they will call you back. Okay,
okay. Thank you so much sir. Thank you sir.
Thank you.
Okay sir, can I speak?
Yes Alvin please.
Sir, I did MBBS from China and graduated in 2022 but I didn't clear the FMGE exam yet, so I'm having a gap of 3 years. So what would you suggest me to do to improve my CV even in future to compensate this 3-year gap and to make my CV better? And also I'm interested
so
in
now you want to start your career in non-clinical, right?
Yes
Dr. Nishtha. I mean 2022 में MBBS किया है but FMG मतलब इंडिया का एग्जाम क्लियर नहीं है so he is not RMP yet.
Sir, also one more question, 1 minute. even if I want to do the AMC, this gap will be an issue, and after FMG only I'll be able to practice in India
So to write the
without the
AMC
experience.
exam, you can
Yeah,
write the exam, no issue, no
yeah,
problem. But getting a
yes,
job difficult because
yes,
ये 3 साल का clinical gap है, आपने कुछ किया नहीं है, right?
yes, yes.
And but you can start non-clinical ASAP. जितना
Okay,
गैप बढ़ता जाएगा इतना ही आपको जॉब मिलने में डिफिकल्ट रहेगा, whether it is clinical or non-clinical, right? So
okay,
maybe you
understood.
can start from pharmacovigilance and then later on you can move. Dr. Nishtha, if you
Okay,
want to say
okay,
something.
Yes,
okay,
yes, definitely PV you can consider. And
okay,
additionally, think of clinical research options as well. Medical writing, clinical research. If you're looking to appear for some additional exams to qualify,
mm-hmm.
alongside you can do good amount of clinical research, clinical trials. They do it remotely. Like we have a clinical research course as well. So this will add to your CV.
Okay, thanks.
Yeah.
Yes, who's next?
Hello.
Arindam. Divyansh Arora, can you please unmute?
Yes, sir. Hello, Dr. Divesh Arora here. I am a 31-year-old MBBS doctor from India, and I have completed my MBBS in 2019.
Okay.
After that, I am having 3 to 4 years of clinical break, career break due to some personal reasons and family responsibilities. But since last 1.5 year, I am working as a junior resident in Max Hospital, and so you can consider me a fresher, or it's just 1.5 year of experience, clinical experience I'm having. So I am having a question to Akram sir and Nishtha ma'am, both. Sir, actually, what will be good for me? Actually, I want to go for some non-clinical role, and what will be good for me, DSP or medical science, MSL? I mean, what, or something else? What will be good for me in future perspective, in growth, future growth, and a good salary package?
Yes, Dr. Nishtha.
Yes, yes. So, a good salary package will be there in both the roles. If you go for drug safety physician or the medical advisor, we've already discussed the base payment. As an
Yes.
MBBS doctor, it will be
Yes, ma'am.
difficult to make so much in clinical practice or in hospitals.
Yeah.
So, Max Hospital has given you 1.5 year of experience, which is a good thing. At this point, you're eligible for both. You'll have a
Okay.
good stand in MA or in DSP also, but it will depend on what you like. As we have been discussing, if you like travel, if you're an outgoing person who likes to give presentations, seminars, and you like to
Okay.
interact with other doctors in forums, then definitely MA role. But if you're somebody who likes being by yourself, limited work, something that's manageable and can be done remotely, then DSP. But given the history that you've told about you, you will be eligible for both the roles. Since you are an MBBS, definitely a 1.5 year of clinical experience is a good thing, but you might be paid a little lesser as compared to MD graduates.
Okay, how much less? I mean, what will be the starting for me if I'll ask?
Starting for you for an MSL role can range anywhere between 12 to 15. Again, for MSL or DSP, both the roles. Starting
Okay.
minimum should be 12, ideally. If
I mean, I
somebody is
can say whatever you are earning, you will get 1.5x in
Okay.
simple formula.
yeah.
Okay, sir. Okay, sir. And one more question, ma'am. Actually, nobody's talking about this, but I have done 3 months of certification from Career in Pharma and DSP.
Okay.
Okay.
And after that, I was looking for jobs. And since one
तो
week
उन्होंने
or
जॉब में आपका हेल्प नहीं किया?
G. And since one week, I am looking for the job. And what I have focused and what I have seen is there are very less opportunities in DSP jobs or MSL jobs in Naukri.com. And there, since
Please go
last
to
one week, I haven't found
jobsly.com.
any job
Yeah, please
there.
go to jobsly.com. This is a
Okay.
dedicated platform only for healthcare professionals. वहाँ बहुत jobs है इसका.
Okay, so
Okay?
Jobly.
Jobsly.
Jobs.
jobsly.com.
Okay, sir. Thank you, sir.
Yes, I think Dr. Divesh, you should also connect separately with the team because
Okay.
people are not aware where to go for the right jobs. That's
Yes,
where
ma'am. That's the thing.
students are
Actually, I
lacking.
don't know. I don't
Yeah,
know the. I don't. Maybe I don't know the
yeah,
correct term how to search for a job.
yeah, yeah.
That
That's certainly an issue, you know. And plus, during HR interview placements, they negotiate like anything, and doctors don't even know their value.
Yes,
That's those
ma'am.
are negotiation skills, but you should know what's your value. That's
Okay,
where
ma'am.
we come in for help. So I would suggest, why don't you connect separately?
Okay, sure, ma'am. I'll connect it tomorrow.
Yeah.
Thank you so much.
Thank you.
Who's next, Arindam? Yeah. Uh, Nitin Kanan, can you please unmute?
Yeah, hello. Am I audible?
Yes, you are.
Yeah. Hi, sir and ma'am. I'm actually FMG. I have passed my FMG. I've done my 1 year internship in KIMS Bangalore.
Very good.
And I'm actually aspiring to be a surgeon. I want to take. I'm studying for my PG right now. Classes are going on, and I want to become a surgeon. But on the side, I want to do a remote job. And you told that HOER is a good option to take for people who are aspiring for remote jobs. Am I correct?
Yes, HEOR is one of the options, health economics outcome research. But one should be good with biostatistics and should have a background.
Calculations, mathematics, or
Yeah,
आपका interest क्यों होना चाहिए?
I'm also a trader, a stock trader. I do the full pharmacy. I have a full gist of the Indian NSE pharmacy index. So what the most of the companies that you had listed are most of the Indian companies that I saw, Dr. Reddy's and Divi's Lab and all those companies. So I just want to know this job title, is it fully remote or is it like hybrid type?
The DSP or the MSL role you're talking about? Or
Uh,
HEOR?
HOER.
Okay, so HEOR may be hybrid or remote. Every company has a different requirement. There are some which
Okay.
are offering completely remote, and there are some which are offering hybrid. So thrice a week you come to office, thrice a week you work from home. It'll depend from company to company. It'll differ.
And the initial placement that you'll be getting into for this job title is junior analyst or what is the job
Yeah,
title that you'll be getting?
initially, well, mostly it should be junior analyst if somebody is just entering into the market. But
Okay.
certainly we can try, you know, depending when the time for placement has come and depending on your performance, we'll have a better idea that time when the time for placement is there.
Okay. And I'm also I'm a USMLE aspirant. I'm preparing for my USMLE also.
Mm-hmm.
So how helpful will this
Well,
particular
HEOR will be helpful. HEOR and clinical research will be helpful on your CV because USMLE candidates for them having a strong clinical research profile matters. You know, a lot of them do research assistant position after their MBBS during preparation. So working in HEOR and clinical research both will help on your CV to get you a yes, to get you
sorry,
a
sorry, ma'am.
US, yes, go ahead. I mean, these both things will help you on your CV to get you a residency. Yeah, but in future, whether you'll get a work over there in HEOR or clinical research, that will depend on how you perform over there. In India, definitely it's easier. Over there, if you have some experience from here, things will be quite in sync, but you should just streamline what exactly you're looking for because getting into surgical branches why USMLE is more challenging. Definitely you can. I'm not saying no, but you're having too many things on your plate, from what I understand. You're thinking of USMLE, you're thinking of MS surgery over here, you're also thinking for some remote option. So make sure
No,
that
my MS
scaling.
surgery, I'm
Yes.
trying to actually take surgery in abroad also.
Okay.
So
Only
that's
US or any other country?
yeah, in US or Australia, these are the two options.
Okay. Okay.
So
So
that's why at the moment, currently, I'm looking for a job which can help my profile also. As the USMLE requires
yeah.
these kind of
Yes. Even
resumes.
Yeah, so from my understanding, HEOR, clinical research, even DSP will help you, drug safety physician, because that
Okay.
involves listing, case report assessments, trial assessment, that will also help you.
I think best suitable रहेगा मेरे हिसाब से डेप्यूटी फिजिशियन वाला रोल आपके लिए.
Sorry, what did you say, sir? I didn't.
डेप्यूटी फिजिशियन मेडिकल मॉनिटर जो रोल है ना बेस्ट.
Okay, sir. Sir, also, and you told this is a 5-step process to get into your course. How
Yes.
long is the course actually for? Once
दो
that,
तीन दिन में
once.
खत्म कर देते हैं पूरा रोल को आपको मिलेगा या नहीं मिलेगा. It's not very long.
Sorry, sir, I don't understand Hindi much. Please, can
Yeah,
you talk in?
within 2-3 days you will complete the entire process.
Okay, so the course is 2-3 days,
No,
but the
no.
process of
I
selection.
mean the process you will get into enroll or not in this course.
No, what I'm asking is once after enrollment, how long is this course?
It's a
Is
4
what I'm
months.
4 months course. Okay. Okay, sir. And thank you so much for your information. Should I contact your team or will your
Yes,
contact?
we
Will
will
you be
contact
contacting?
you tomorrow, Dr. Nitin.
Okay, sir.
Okay,
Thank you so
thank you
much.
so much.
That's it, sir. Yeah.
Yes, Dr. Wu Kaneki.
Good evening, sir.
Good evening.
Good evening. Thank you for the opportunity. Actually, the name which is mentioned here is my profile name. My name is Dr. Muhammad Mubarak. I'm an FMGA as well. So my batch got over like class of 2023 from Russia. So basically, what the thing it's a bit long part what I'm trying to say. So it's like I have not cleared my FMG or even NEET PG. It's आगे का है. Currently, I'm working as a claim processor and medical auditor at TPA under Ayushman Bharat program. So right now 3 months complete किया है. 4th month चल रहा है. So along with this, I have prior experience in academic counseling, medical admission, and regulatory support. So I just want to know, this is not my question itself, like I have my friends over who are discussing for further preparations, future mein kya hoga as an FMG, because there are few of my friends who have passed in the 7th and 14th attempts, who are my seniors. So I just want to know the long-term security regarding the job, like regarding the courses you have sent over here. And the main thing is that job stability, income growth, and work-life balance. क्योंकि मैं जब I like past few months back I was in Dubai. I was there for 1.5 years. So उस time पे उधर भी pharmaceutical industry में there was repeated like primary options as well. And I understand that whether this is due genuine demand or a limited alternative है क्या? Like in the pharmaco sector regarding HERO and
First of all, you are a medical doctor, so your role totally different from pharmacist or other
sure.
कंपेयर
Understood,
के
sir.
भाई कि उसको कितना मिल रहा है या उसको जॉब है नहीं है.
Fine.
You are a medical doctor first of all,
Okay.
So scope is very very huge. But next if you want to add in.
Yeah. Sure. Now, see, pharma industry is such that you will have opportunities no matter what. If you look at my colleagues also, see, there are layoffs. There are layoffs in
Fine.
companies like Microsoft, Amazon also, which is
Sure.
expected.
Sure, ma'am.
But even if any of my colleague or senior gets laid off from one, they get immediately into another pharma. So I've not seen anybody who's just sitting at home. They
Okay,
get
understood.
into some or the other role and some or the other company.
Fine,
So
ma'am.
definitely you will never be sitting idle. There is a lot of scope. Now hard work is there when you are working. At least you don't have emergency shift. So it's a balanced lifestyle. It
Okay.
cannot be like somebody is working only 1-2 hours and expecting the work to be done.
Sure,
You have
ma'am.
to be working hard also. Yeah, but it will
Okay.
be balanced. And even if there are layoffs in a particular company, there are plenty more waiting. My
Fine.
colleagues have got calls through the companies themselves. They didn't even have
Okay.
to reach out when they were laid off because there were certain companies, 1 or 2, which were shutting down India operations, right?
Okay.
So they were laid off in 1 month's time. But they
Okay.
didn't have to search. They got calls themselves. The companies called them. They didn't even
Okay.
have to go out searching. So
Understand,
there is an
ma'am.
opportunity in one or the other company for sure.
Okay. Can I add on like as a first person who is listening this webinar for the first time, question to both Akram sir and to you, ma'am, actually. So it's from a 5-year perspective, which roles are at least affected by automation or market trend on? क्या हो सकता है?
Well, to be honest, in pharma, no roles are replaceable. Even if AI comes in, medical advisor role will definitely be trending, even DSP role. Well, it's being told that radiology as a branch may see some saturation with AI coming in. And some other medical branches, but pharma will always have scope. Plus, there is Make in India coming in, like Sir mentioned, a lot of pharma industries are opening newly. And especially because India has a big OTC market. Over-the-counter market in India is very huge when it comes to pharma. So there will always be a scope, be it 5 years down the line or 10 years down the line.
Okay. Ma'am, can I add one more? How entry friendly is this for a person who is an FMGE?
Entry friendly, as in the course, or
as in these courses that you have described over here, like MSL, HERO, and even pharmacovigilance, etc.